Mine online also called Ribe, who was actually supposed to be with us, but he couldn't come in person. So for today's presentation, I'll be presenting on the G-enabled microplanning for immunization in Bangladesh, which is work that we, the GIS Center, supported the government of Bangladesh on. So the outline of my presentation is pretty straightforward. I will touch a little bit on just what is a G-enabled microplanning, and then straight away go to the microplanning for immunization in Bangladesh, where we'll look at the overview, stakeholders and timeline, tools and methodology that we used in this particular work, best practices and achievements, challenges and opportunities, lessons learned, and if time allows, I will quickly touch on some of the future work. So maybe before I begin, is anyone from Bangladesh in the room? Okay, so I'll be quick. So a G-enabled microplan is basically, as you can see from the left-hand side of the screen, as you can see from the left-hand side of the screen, is pretty much, we're using the traditional methods that are applied in the microplan, but what we're doing is the hand-drawn maps are basically then digitized and converted into GIS maps. But the most important element there is basically the using of the community knowledge to fertilize this information and enrich it with GIS. And what that means is we are able to have a data-driven and digitally enabled microplan infused with geospatial data and technologies. And this, of course, with time, has been known to provide a lot of efficiency and planning. So, why do we need to G-enable the microplan? So basically, this is not something very new to many of you probably, but one of the key areas we're looking at is basically we're trying to address gaps in service delivery, such that we reach really the largest population that we can, but most importantly, we don't want to miss out anyone in the population. And also we want to be able to use this to improve efficiency in service delivery, especially during these campaigns. But also one thing that has always been known to happen during microplanning is the wastage and the duplication. So with the G-enabled microplan, this basically reduces these eventualities. On the left-hand side, basically, what is it that we are G-enabling? So the two components of a G-enabled microplan is basically just the mapping section and then the demographic data that you see below, which is pretty much a spreadsheet with the administrative boundaries of the different places. So this slide basically is the ingredients that we used in Bangladesh to achieve a G-enabled microplan. And basically the satellite imagery, travel time, but also the spatial population, which is basically the count and distribution of the households, and also the health facilities where they're located, and the catchment areas. The travel time one is optional in the approach that we will be looking at, but it's also something that is a very crucial ingredient in G-enabling a microplan. So allow me just quickly introduce this slide, which basically shows you a team of the GIS Center colleagues at WHO, who I will call them champions of GIS within the organization. And we have a joke in our team that a map can begin in Seattle and end up in Fiji. You know, we can start developing a map from Fiji or end up in Nigeria. That is how geographically distributed we are around the world to support WHO at all levels. So what do we really do? So the methodology that we use usually is a three-pronged approach, which is advocacy, service delivery, and support to the countries, but most importantly, capacity building. So we try to, at all levels of the organization, which is HQ, regional office, and country offices, to advocate, provide service and technical support, and basically build capacity globally. Back to Bangladesh. So when we were called by the government, the Ministry of Health, to support and pilot the geo-enabling of their microplan, they were looking at basically three objectives, which is to build capacity on foundational GIS mapping and microplanning, which is basically just training in GIS and geo-enabling that, to implement and generate basically GIS and microplan granular data, which is demographic data, where people located, how many people are in the different locations, and most importantly, to scale this approach nationally. So we started with a pilot, which looked at about 3 districts and 2 city corporations. And the first thing we did, as you can see from the top left, which is basically a hand-drawn map of one of the areas that the team worked on, was to carry out a very quick accessibility time travel analysis to determine basically where the facilities and the access to these facilities by the community in these locations. And so when we ran the first planning workshop, this was then used as a precursor to the discussions of the different strategies that would be required to implement this. So real quickly again, this is the administrative boundaries of Bangladesh, but most importantly, if you look down there at the programmatic level is what we were mostly interested in, because these are where the actions usually happen. A lot of discussions happen up, but most times when it comes to implementation, we know that the real action happens down there. So on the right-hand side, those are the 3 districts that we selected to pilot this geo-enabling of the microplan, and this was particularly to the EPI program. So these are I would call them warriors that we basically had to interface with, and of course, in total, about 712 people at different levels of the government, from the GIS Center for Health, WHO, and also from the Bangladesh country office. All these people were needed to be able to reach or achieve what we were able to achieve. So again, in terms of timeline, this basically, as you can see, we're having a chat a little earlier on that the biggest part of using technology in what we do is usually the people, which is the consultations, the meetings, but if it's the deployment of the tool, it's usually quite simple. So as you can see, this almost, I would say, a year and plus just to reach to the point that we have been able to reach, and because you need to do a lot of consultative meetings that we were able to do across. And as I speak, they are scaling up this across the country. So tools and methodology, this may look a bit congested, but I want you to pay attention to 3 sections of this. So there's the upper side, which basically the themes that we were focusing on. But in the middle part are basically the ingredients that we deploy to achieve what you see up there. And the bottom half, I would call them enablers. So these are the things that we needed in place to be able to achieve all those. So the first one is basically pretty much similar to any other thing, which is scope and planning. So basically, we were able to define the area of interest that we needed to conduct this particular exercise, looking at the capacity, calculate basically the number of, first of all, the project, budget, and also the number of, the type of campaign that needed to be done in this particular case. And down there, the enablers, of course, the usual people, the country team, stakeholders, and program teams. And of course, with support from country office and the regional and HQ. The second part, which is where the fund begins, is basically the base mapping. So the base mapping, again, as you hear it, basically we collected, we got high resolution satellite imagery of the place. We printed them, and there were, I don't know, over more than 100 satellite images that were printed and brought together. And from that, we were able to then organize a workshop that basically had the different focal persons at these districts to clearly pick out which are the different locations of health facilities, where do people live, where is your area, and basically which areas of this particular district will you be working. And as you can see in the middle picture, people are pretty much drawing on the base maps and the satellite imagery to be able to pick out this, just densifying it with all the different elements that they know. There's a river here, yes, there are households here, there's a hospital here, there's a mosque here, but depending on the strategy that they were using. And the third section, which is field validation, again, we picked randomly a couple of locations that we checked on the ground if these maps that we densified they actually exist, these locations exist where the community members say they did exist. And from this, we also were able to pick out some areas that previously people didn't know that people actually live here. You could then go and find that there are people here, and you're able to reorganize the teams, the grouping of the teams, because sometimes you had planned that this section may need about a team, then you may need more teams to be able to cover a certain period, a certain area. And the areas that we found that were unvisited, they had never heard of any of the campaigns done before. So this we were able to pick out again by doing field validation. And at all points of this, we're basically checking for the accuracy of the information that is being shared by the community members, but also cross-referencing with the satellite map and with the different data sources like OSM and Google Earth. Lastly, which is the mainstream part, so what we came out with is again, general dashboard that shows the demographic elements that we needed to be able to carry out the geo-enablement of the microplans. And from that, which has, of course, the boundaries of the area that's going to be covered, we also had to print different maps that we were then given to the focal persons to be able to do the field work. So a couple of more slides to go. So these are the results from what we managed to do. This is Rakshai, GIS mapping and microplanning workshop. As you can see, things that were done, about 300 sub-blocks, but most importantly, these were spread across 30 wards, 6 zones, and we were able to map out 300 vaccination center points were mapped, and also 30 ward boundaries in 6 zones, and we're able to create what you see on the right, which is the API digital microplanning dashboard. Again, to be able to plan accordingly. And from the pictures, as you can see, the community members and focal persons at these locations densifying the satellite imagery. So again, some of the work that was done, this is for all the 3 districts and the city corporations. Of course, the training in GIS and microplanning, the workshop that was done across 19 upazilas, and these upazilas, as you saw from the stratification of the administrative areas, is pretty much, I would call it, after the districts, then you have the upazilas, then you have the districts. And then in total, about 30 CMOs were trained. These are surveillance, information and medical officers and data managers were trained, and they very much contributed to the mapping work that was done there. And the features, including mapped features, were boundaries and vaccination centers. This, as I mentioned previously, about 300 of them. Then we did a data validation exercise. I've been told my time is almost up. So these are pretty much pictures now for you. So this shows, again, the workshop. In the top left hand, you see the commitment. In the middle of darkness, you're using torches to pretty much pick out these locations. And the middle picture there is my colleague Samuel Ayoribe, who was deployed from the JS Center for Health. And you see the community members in a big hall like this with satellite imagery, just densifying it with the different features. And the bottom left is basically the digitization of these locations. Again, more pictures. On the top left there is Ravi, who is the head of the GIS Center. He also traveled all the way to Bangladesh to support this. That's my colleague Asela, supporting again the same activity. So this is what we're able to do. I'll just go quickly now because this is pretty much results of what was done. So in less than 2 minutes, I will try and summarize the challenges. So one of the challenges which I believe cuts across is usually the human element of trying to first of all engage with the Ministry of Health, trying to get people to get on board with what you're proposing, but also very clearly the access to some of this data is not always there. Finding data that is quality and is good for purpose is usually not easy. And also prior lack of knowledge in the communities or in the districts on familiarity with basically geospatial data and how that is applicable in public health, because we're used to doing it in a certain way that may not sell as quickly as we intend to. And of course, political buy-in, which is usually a major one, which strangles almost everything. And then there's, of course, the involvement and continuous involvement of stakeholders at all stages of implementation, because this is the only way we can advance that. But also along the way, there are so many opportunities that we're able to pick out, which is we're able to get granular programmatic data that was then given to the districts to use. As part of the workshop, of course, the trainings that were conducted, and also the strengthening of engagement with government and decision makers. This is my last slide, which is the lessons learned. So there has to be a lot of improvement on monitoring of the campaigns, and also understanding the ground realities, basically, of who are the different stakeholders in this place that we need to engage with. And reducing silos across the team, which comes with constant engagement, but also we managed to provide these digital tools that were used and are currently being used to supplement and support the EPI program. So I won't go further than this because my time is up, but as you can see, these are just recommendations and next steps, which is currently they're scaling this across the country. Thank you very much.
Okay, thank you, Sam, for your nice presentation. Please keep your questions for the end of the two presentations. Now, let's move for the next presentation by Chris. Chris, over.
Thank you very much. Good morning, everyone. Yes, I'm Chris Warren. I'm a Senior Supply Chain Technical Advisor with the U.S. President's Malaria Initiative based in Washington. Before I get started, just wanted to say I've really enjoyed the conversations and presentations the last day. One of the things that has come to mind is that we all seem really interested in understanding the answer to the question of whether the nets that we have supplied have gotten to the households they were intended to go to. So it's been good to see that It's been good to see that, we talked about, the processes to achieve that. And yesterday we were talking about some of the tools involved in planning for decision makers to figure out where net should go. And then, of course, the other tools that help support programs to, measure the results and execute the activities. Thanks, Robert. So in light of that, I wanted to present to you today a presentation entitled TraceNet Enabling Digitalization. Nope. And some of you may have heard of TraceNet. You may have heard of GS1. This was all compacted back to 2018 when PMI and Global Fund convened manufacturers, suppliers, procurement service agents, and key partners from in-country programming to discuss standards for identification, labeling, and data exchange for ITNs. So this is part of a global strategy that we see across global health for we often refer to it as global standards. And so this is the concept of having standard identification, labeling, and master data exchange capabilities for all health commodities. This is a foundation block, so to speak, for health system strengthening efforts. It supports host country governments to develop their strategies, implement activities, and it's a strategic engagement across the continuum of the supply chain and the value chain for health commodities. So it's engaging with donors, funders, program implementers, and the marketplace. So when we apply the practice of global standards for health commodities, and as we are doing under TraceNet, we have three key concepts to get across here: identify, capture, and share. And so we start with identify. This gets to the issue of what is it? This is where manufacturers are providing consistent identifiers for key attributes for ITNs. We want to have a same way of describing products across manufacturers, across brands within manufacturers. You have to think about that the ITN itself is a trade item. It has unique attributes, and those attributes need to be consistently described by manufacturers. So if we know what to call it, the next part of the conversation is how to convey that information. So the capture phase is where manufacturers are conveying the product attributes using standard data carriers. And if we think about the category of ITNs, there are really three forms that we're looking at. We're looking at the bale, the individual bag for an individual net, and the ITN itself. And so the attributes that are being described are different across these three elements of the ITN, and as well as the way that the data is being conveyed. So for example, on bales, we are using barcodes, and for ITNs, we'll be using 2D matrices. So we've identified, we've captured it. The third element of a global standards piece of work is sharing. And sharing is where this data that's been adequately identified and now captured is able to be shared. And who's it shared with? It's shared with all of us, from the point of manufacturer to the procurement agents to the programs themselves. This is the key element beyond just the labeling, but the data behind it that can be conveyed. And what are we conveying? Well, again, those key attributes: what the product is, what size it is, who is the product manufactured for. So that's the kind of standard label. But under TraceNet, we also have some very interesting pieces of information that's being conveyed. And that's unique numbers for each bale and unique numbers for each individual ITN. I like to think of this as sharing is caring. So we started in 2018. So where are we today? Well, we have the recommendations. These have been published. And for PMI, AMF, and Global Fund, these recommendations have been converted or adapted for use in the contracts for ITNs that are procured with funds from PMI, Global Fund, and AMF. We have actual nets that are in circulation. They've been procured, they've been delivered to country, and that information that is conveyed on those data carriers has been captured, and we are receiving feedback from the community of users on that experience. Hopefully, while I'm talking about this, if you haven't had an opportunity to see it before, you may be thinking of some use cases, particularly around opportunities to leverage this label and the data behind it to improve efficiency in ITN programming, improve your accuracy, improve the ability to exchange the data, monitoring the evaluation, inventory management, and leakage and diversion control. For the rest of the presentation today, I'm going to focus on two of these, efficiency and accuracy, where the intent is really to improve overall certitude in ITN supply chain and increase the overall confidence in and the integrity of ITN programming. I think it's important when we have a new technology at hand that we are interested in using, that we think about the sort of a cost-benefit analysis. What is the current level of effort that we are currently doing within our current practices and procedures, and what might have to be adjusted or balanced against the possible exchange of LOE. So I kind of look at it for an opportunity to sort of answer three questions. If you have an ITN somewhere out there, it would certainly be nice to be able to confirm that it is an authentic ITN. If you have an ITN or a bunch of ITNs, it would be great to be able to answer the question, are they where they are supposed to be? And possibly, where have they been? I want to emphasize that the labels and the data behind them, they are very powerful. There are a lot of use cases for this, but they are passive unless they are used and used effectively. So remember those questions I raised on the nets and wanting to be able to find out more information on them? So one of the things we have to think about when we want to authenticate or verify a net is that there is a label. You can read the label. You'll be able to see what it is. You'll be able to see that there's a unique number on it. You'll be able to see that the bale that it came in had a unique number. Just having that would would empower you to have the ability to figure out if this is a net that is supposed to be in circulation. Of course, if that data had been captured and shared across the continuum of the supply chain, the ability to answer those questions much more quickly would be enhanced. However, if the data conveyed on the label has never been captured or shared at the country level, it's going to be harder to determine where it should be. We call that track. And it's also going to require more level of effort to determine where it came from. You'll just have this label. It's going to tell you that it's the right label, but you're not going to have any information unless you can figure out where it's supposed to have gone and where it's come from. Again, there are many opportunities to capture and share the information when ITNs change hands, all the way from the point of where the manufacturer is loading them into containers until those nets are distributed to a household member. For PMI, we're looking at the opportunity to work with manufacturers to see the capacity or the capability to not only load containers with an understanding of which of the quantity of ITNs in each container, but even more detail on which bales went in which containers. We think that is something that if it can be done, will improve your ability to receive nets, confirm that the quantity you were expected was received, and again, give more overall confidence into the integrity of your ITN supply chain. We've heard a lot over the last couple of days where there have been challenges with processing the tech or adapting the tech into existing processes. Similar here, we understand that leveraging this enabler that I've been describing, this output of the TraceNet, is not simply a matter of inserting scanning into your existing processes. We have to be looking at the overall LOE when we change our processes. Is that additional activity or the other activities that need to be changed around it going to result in greater accuracy, greater confidence, and a greater level of efficiency? We have to be thinking about what business processes have to change, what material handling processes have to change, and what material handling equipment may need to be changed or adapted in order to, again, reap the possible benefits of TraceNet. Again, the nets are in circulation. They continue to be procured with these attributes. They are out there. Most importantly, at this time, we're receiving more and more feedback from the user experience. We're hearing, how easy or difficult it was to scan or read the bales. How are the labels being attached to bales or ITNs? And we have been recently reconvening the TraceNet community to process this feedback, develop and fine-tune the recommendations, and again, use those refined recommendations to further our efforts in improving certitude, confidence, and the integrity of the ITN supply chain. I thank you for your time. If you have any questions at some point, you can find me either in the panel or after the panel convenes. Thanks very much.
Thank you, Chris, for your nice presentation. So our last speaker for this session is Joseph from the Congo Republic, right? Are you going to present in English or French? French. Donc, Monsieur Joseph va faire sa présentation en français. Thank you. Over. Merci.
Mesdames et messieurs, bonjour. Je suis Monsieur Joseph Admio. Je représente le programme national de lutte contre le paludisme de la République du Congo. Et tout en remerciant les partenaires pour l'opportunité qui m'est offerte, je vais partager avec vous l'expérience de la digitalisation de la campagne de distribution de masse des MILDA qui s'est tenue en 2022 dans mon pays, mais avec un accent mis sur la traçabilité des MILDA. Je veux passer. OK. Avant d'aborder le sujet sur la traçabilité des MILDA, j'aimerais rappeler un peu le contexte épidémiologique du paludisme au Congo. Elle demeure la première cause de consultation, la première cause d'hospitalisation et la première cause de mortalité dans mon pays. Et le pays lutte contre la maladie à travers la combinaison de plusieurs stratégies et d'interventions de lutte, telles que l'utilisation des moustiquaires imprégnés d'insecticides par la population. Et pour ce faire, des MILDA sont distribués en routine auprès des populations, auprès de la couche de la population la plus à risque, notamment les femmes enceintes et les enfants de moins de 1 an. Aussi, des campagnes de distribution de masse sont organisées tous les 3 ans. À ce jour, le Congo a déjà organisé 3 campagnes de distribution. La première en 2012, la deuxième en 2019 et la troisième en 2022. La campagne de 2022 se distingue des deux précédentes campagnes parce qu'elle a eu la particularité tout d'abord d'être la première campagne à avoir intégré le processus de digitalisation, avoir intégré le processus de digitalisation, et aussi par rapport à la stratégie de mise en œuvre. En effet, elle a été organisée en une seule phase, donc le dénombrement a été couplé à la distribution et le tout s'est réalisé en porte à porte. Alors, quels sont les objectifs et les acquis de la digitalisation? Alors, si on reste dans le contexte de la traçabilité des MILDA, l'objectif de la digitalisation, de la campagne de 2022, était d'améliorer la traçabilité des MILDA à différentes étapes de la campagne. Et comme acquis au résultat, nous avons pu obtenir l'amélioration de la gestion des niveaux des stocks dans les entrepôts des aires de santé en particulier. Et là, on fait surtout allusion au contrôle des sorties et des retours de ballots ou de pièces de MILDA au niveau des entrepôts, particulièrement des entrepôts des aires de santé. Et aussi, comme autre acquis, nous pouvons citer la rationalisation de la distribution. Il faut dire qu'il y avait le PNLP Congo avait prévu un ratio de MILDA en fonction de la taille de ménage. Et donc, la digitalisation nous a permis de faire respecter ce ratio. Comme autre acquis, nous avons l'anticipation nous avons eu l'anticipation des ruptures de stock et enfin la réduction des pertes, voire des détournements dans certains cas. Vous avez là les différentes étapes, les différentes étapes clés de la digitalisation, de la campagne qui ont été digitalisées, mais nous restons toujours dans le cadre de la traçabilité, bien sûr. Et à ce niveau-là, les différents processus qui n'ont pas été digitalisés, on peut citer le transport et le prépositionnement des ballots de MILDA au niveau des entrepôts, parce qu'il faut rappeler que nous avions eu 3 points de prépositionnement avant le début du dénombrement et de la distribution. Et le premier point de prépositionnement, c'était les entrepôts du niveau central. Ensuite, nous avions aussi les entrepôts du niveau départemental et enfin les entrepôts les entrepôts des aires de santé où venaient s'approvisionner les récos avant de se déployer dans les ménages, dans les villages ou dans les quartiers. Mais il faut dire cependant que tout ce processus-là, justement, n'a pas été digitalisé, mais aurait pu l'être. Et pour ce qui est du processus digitalisé, nous avons le contrôle des sorties et des retours des stocks des MILDA dans les entrepôts des aires de santé par les relais communautaires. Aussi, nous avons eu le dénombrement et la distribution dans les ménages. Ces différentes étapes ont été toutes numérisées. Et pendant la phase de dénombrement et de distribution, les informations clés qui avaient été fournies à travers la digitalisation, nous avions le nombre de MILDA qui était requis pour chaque ménage et aussi les références, les identifiants de chaque MILDA distribués après le scannage des codes à barres. Aussi, nous avons eu également comme information clé à collecter au cours du dénombrement et de la distribution les coordonnées géographiques de chaque ménage servi à travers la géolocalisation, le système de géolocalisation. Quant aux outils de la digitalisation, il faut dire que nous avions eu recours à l'expertise de Red Rose et qui avait mis à disposition 3 outils essentiels qui nous ont servi lors de cette campagne. Nous avions l'application mobile One Health, ça c'était notamment pour la collecte, principalement pour la collecte des données. Nous avions aussi la plateforme One Platform qui nous a servi notamment pour la gestion des utilisateurs et la gestion des données. Et puis nous avions le Power BI, le Microsoft Power BI qui nous a servi essentiellement pour la visualisation des données. Et comme dispositif, nous avions besoin, dans le cadre de cette campagne, des téléphones Android et des ordinateurs. Et dans le cadre de cette campagne, il faut dire que les récos et tous les responsables des aires de santé avaient été dotés d'un téléphone Android de marque Samsung A31. Pour ce qui est des fonctionnalités des différents outils, là nous avions l'application OneApp. Les fonctions clés de cette application étaient justement la prise de stock des MILDA dans les entrepôts. Il faut dire déjà, il faut rappeler que cette application a été utilisée par les relais communautaires au cours de la phase de dénombrement et de distribution. Donc, ça leur a servi surtout au niveau de la prise des stocks des MILDA dans l'entrepôt pour enregistrer les données sur les quantités de stocks approvisionnés et aussi pour la distribution virtuelle des MILDA dans les ménages. Et comme point fort de cette application, elle permettait la collecte des données même sans connexion Internet. Donc là, vous avez une capture d'écran du résumé du processus de dénombrement et de distribution avant la validation dans l'application Red Rose. On peut voir le nom du responsable du ménage, le nombre de personnes vivant dans ce ménage-là, les coordonnées géographiques de ce ménage et aussi le nom, l'identité du réco distributeur et du réco dénombreur. On a aussi les identifiants des MILDA qui vont être servis. Ça se génère automatiquement après avoir scanné la quantité de MILDA à servir, après avoir scanné chaque MILDA. Ensuite, nous avons aussi la plateforme en ligne. Je citais la plateforme en ligne Red Rose. Elle avait comme fonctionnalité clé l'intégration des données de la microplanification et aussi comme autre fonction clé, elle permettait le téléchargement des rapports des opérations du dénombrement et de la distribution. Et là-dedans, si on reste dans le cadre de la traçabilité des MILDA, on pouvait télécharger les données sur les quantités de MILDA distribuées par ménage et aussi les identifiants des ménages, les identifiants des MILDA distribués. Le troisième outil, c'était le lien Power BI. Et donc, je le disais tantôt, il permettait, comme fonctionnalité clé, il y a la visualisation des données et puis le suivi de la distribution en temps réel à travers des graphiques et des scores. Ok. Là, vous avez là une illustration du processus de dénombrement et de distribution. Sur la première illustration, nous pouvons voir le binôme de réco qui se dirige à l'entrepôt pour l'approvisionnement journalier des MILDA. Et sur la deuxième illustration, nous pouvons voir le réco des nombreurs qui renseigne dans le téléphone le nombre de MILDA reçus. Bon, mais ça, c'est juste l'information clé qu'on collecte que j'ai cité dans le cadre de la traçabilité, mais sinon, il y a bien d'autres informations qu'ils doivent renseigner avant, effectivement, de pouvoir s'approvisionner. Donc, l'information clé ici, c'est le nombre de MILDA qu'ils ont reçus. Et ensuite, sur la troisième illustration, nous pouvons voir que ça, c'est une illustration du dénombrement et de la distribution dans un ménage. Donc, à l'aide du smartphone et de l'application mobile, le réco dénombreur devrait dénombrer le ménage et l'application, elle, géolocalisait automatiquement le ménage. Ensuite, générer aussi automatiquement le nombre de MILDA requis pour ce ménage en fonction de la taille du ménage. Et ensuite, par la suite, le réco dénombreur devrait scanner à l'aide du téléphone les codes à barres de chaque MILDA à servir dans ce ménage. Et enfin, le réco distributeur distribuait les MILDA aux bénéficiaires. Comme point fort du processus de digitalisation de cette campagne, nous pouvons retenir la géolocalisation des ménages bénéficiaires, la remontée des données, la remontée instantanée des données de la distribution, le suivi en temps réel de la distribution par les superviseurs de tous les niveaux de la pyramide sanitaire, y compris le ministre de la Santé du pays qui avait un œil sur cette campagne. Et on avait aussi la possibilité de suivre en temps réel les niveaux de stock dans les entrepôts des aires de santé en particulier. Et enfin, nous pouvions apprécier la concordance entre les MILDA distribués et la taille des ménages. En termes de points améliorés, nous pouvons dire que la digitalisation, nous pouvons citer la digitalisation de tous les maillons de la chaîne d'approvisionnement et de la chaîne logistique, notamment depuis le port jusqu'à dans les ménages, parce qu'on a vu dans les diapos précédentes que toute la phase d'acheminement des MILDA depuis le port jusqu'aux entrepôts des aires de santé n'avait pas été tracée par le biais de la digitalisation. Et aussi, la digitalisation, nous pouvons aussi dire la digitalisation de la micro-planification des aires de santé et des enquêtes de suivi post-distribution, parce que il faut dire que les données de la micro-planification, durant cette campagne, les données de la micro-planification, bien sûr, avaient été intégrées dans la plateforme, mais c'était à travers des outils externes qu'on élaborait des microplans et ensuite on les importait dans la plateforme. Et ce qui serait bien, c'est qu'on ait un outil qui nous permette de réaliser les micro-planifications dans les aires de santé ou dans les districts sanitaires, voire dans les départements, directement à travers un outil digitalisé. Parmi les difficultés rencontrées, nous pouvons citer la connectivité Internet limitée dans certaines zones, aussi le défaut de fabrication ou l'usure de certaines MILDA, Enfin, on a connu aussi des bugs du système ou des défaillances techniques qui nous empêchaient parfois de capter facilement, qui empêchaient parfois, enfin, qui donnaient parfois des difficultés au RECO de capter la position du GPS, sans quoi il ne pouvait terminer le processus de dénombrement et de distribution. Et comme leçon apprise, nous pouvons retenir que la digitalisation facilite la collecte des données et permet la remontée des données en temps réel. Aussi, au niveau de l'adaptabilité rapide, la digitalisation facilite la prise de décision et permet donc des ajustements rapides en fonction des retours du terrain. Et enfin, au niveau de la sécurité des données, elle permet la protection des données sensibles liées à la distribution. Sur ce, je vous remercie pour votre attention. Oui, je voulais juste ajouter que pour des éventuelles questions, nous sommes en équipe. Il y a Jean-Michel de Cérès qui est avec moi et qui était aussi à la manette dans le cadre de la digitalisation de cette campagne. Donc, il pourra toujours nous appuyer pour les réponses, les éventuelles réponses.
Ok, merci beaucoup Joseph pour votre brillante présentation sur la situation de la distribution en République du Congo. Now, time is for question. We have about 20 minutes for questions. We will take a series of 6 questions, and if time permits, we can take another round of questions. Over. Yes, Mike.
Hi, my name is Abhishek. I'm from Eagle. My question is to Sam. Sam, thank you for the presentation. It was very insightful. So from your experience, I have 2 questions. So from your experience, do you generally advocate reusing the boundary data from the previous campaigns if it is in the same geographical area? Or do you recommend you reusing the data sets from Grid 3 or shape files from other open sets? And from your experience, what are the challenges and opportunities in either way? My second question is, from your experience, what are the reasons, if any, for low adoption of GIS-based microplanning? Thank you.
Thank you. Another one? Yes.
Can you repeat the last question? Sorry.
Sure. So what are
Wait a
the
while.
reasons, if any, for the low adoption of GIS-based microplanning?
Yes, okay. Yeah. Okay, next question, please. Yes.
Oui. Merci, Sirag Afoukou. Je suis le coordinateur adjoint du PNLP Bénin. Ma question s'adresse au Congo. Je voudrais savoir par rapport au point fort, est-ce que la digitalisation n'a pas permis d'améliorer les aspects financiers, la génération des états de paiement, le paiement en ligne, par mobile money et vice-versa? Parce que vous n'avez pas abordé ces aspects. Merci.
Thank you. Another one? Yes, please.
So thank you for your presentation. This is to Jose. And my question is, one of the advantages you mentioned about use of the digital platform was helping you in rationalization of the ITNs. Perhaps in the context of universal coverage, how was this done? And maybe you may expound on that so that you may be able to understand why the need for that. Thank you.
Thank you. Let's go, yeah. Giovanni.
Merci, Dr. Rock. La question, c'est pour le Congo. Est-ce que en scannant la moustiquaire individuellement, on ne sait pas beaucoup plus créer les problèmes plutôt qu'en résoudre parce que si on ne pouvait pas scanner la moustiquaire, on ne pouvait pas la distribuer. Du coup, comment est-ce qu'on faisait? Donc, est-ce que finalement, on ne s'est pas tiré la balle dans le pied? Merci.
Thank you. Yes, please, sir.
Merci, c'est Nissi RDC. Je voulais poser la question au Congo pour savoir, premièrement, d'abord, est-ce que les moustiquaires, quand on les a fabriqués, avaient déjà des QR codes? Et puis, je voulais savoir s'ils ont eu des problèmes de doublons de QR codes qui ont été scannés 2 ou 3 fois, comment ils ont géré ça? Concernant leur tableau de bord avec Power BI, quand ils ont traqué les moustiquaires au niveau des aires de santé avec l'application Red Rose, maintenant je voulais savoir comment ils ont fait cette liaison vers Power BI pour voir les moustiquaires qui ont été scannés au niveau des entrepôts et les moustiquaires qui sont scannés chaque jour avec l'application pour avoir au niveau des tableaux de bord la gestion des stocks pour savoir s'il y a rupture ou pas. Comment ils ont fait ça et comment ils ont pu gérer ça. Merci.
Okay, thank you. Yes, sir. Yeah,
Hi, this is Parambir Gill from the Global Fund. In addition to what Abhishek said, just wanted to understand what were the learnings from the GIS planning regarding overlaps or gaps in administrative boundaries, and did you find any learnings of migratory populations when you were doing microplanning? That's one. And to Chris, just wanted to get a clarification on the requirements for the bail identification. Because are we saying that we're going to, you showed the requirements that said there's a GTIN on the bail, but it doesn't require a serialized number. So how are we talking about unique bail identification? I'm a little confused. So if you could just shed some light on that. But just wanted to thank the presenters for really, really informative and wonderful presentations. Thank you.
Thank you, sir. Any question else? Yes.
Donc, merci au présentateur. J'avais juste quelques questions pour Congo. D'abord, pour la digitalisation de la traçabilité des moustiquaires, qu'est-ce qui a motivé le choix donc, de la traçabilité? On sait que dans le cadre de la campagne, il y a beaucoup d'aspects. Pourquoi ils ont ciblé de façon spécifique cette traçabilité? Et l'autre question, est-ce que le suivi de la traçabilité, donc c'était jusqu'au niveau des ménages pour l'identification vraiment des ménages qui ont bénéficié de ces moustiquaires? Et le dernier point, donc, est-ce qu'avec les 3 applications qu'ils ont utilisées, est-ce qu'il n'y avait pas de difficulté par rapport à la synchronisation des données? Merci.
Thank you. One last question. Yeah.
So I have a question for the Bangladesh. How much did the exercise cost? And how much did the exercise cost? And would you do anything different for the scale up in terms of the process? And the second question I have is for Chris. How many countries are actually tracing all the way down to the lowest level using the GS1 system?
Thank you. Let's give the floor to the speakers. I'd like to start by Chris. Over.
Thanks, Paramber. There's 2 data carriers on the bail. There's the G10, which is describing the product, and then there's an SSCC, which is the unique number associated with that bail. Also on the label is the total count of the quantity of ITNs included inside each one and the sequence of the bail. So if there were 50 bales in the shipment, it would say this is number 3 of 50. The second question was,
Please, Chris, can you speak more louder, please?
Sure. There's 2 labels, the G10 and the SSCC. On the second question was how many countries are tracing all the way. I think that clarifier of all the way down to the household level is really important because I do not have a count on that, but I would suspect there are very few countries that are capturing and sharing information on not only the quantity of bales and ITNs, but which particular bales and ITNs are being received from the port through to the distribution at the household level. That's my general observation so far. Thanks.
Okay, thank you, Chris. Joseph, you have some questions. Go ahead, please.
Ok, merci beaucoup pour les questions. Concernant la première question sur les paiements en ligne, effectivement, la digitalisation a aussi contribué dans ce processus-là. C'est juste que si on ne l'a pas mentionné ici, c'est juste qu'on était resté plus ou moins dans le thème qui nous avait été attribué, c'est-à-dire la traçabilité des MILDA. Voilà pourquoi on n'a pas évoqué certains aspects qui étaient aussi liés à la digitalisation. Mais sinon, effectivement, la digitalisation a permis aussi le paiement en ligne. Je peux d'ailleurs me faire appuyer peut-être par Jean-Michel qui pourrait en dire plus. Jean-Michel?
Have you
Bonjour
finished?
à tous, bonjour à tous, je suis Jean-Michel et je travaille pour CRS Congo-Brazzaville. Pour la question sur est-ce que la digitalisation a permis de gérer les situations de paiement? Exactement. En 2019, à l'époque, en 2019, la distribution qu'on a faite à cette période-là, les listes, donc les acteurs de terrain émargeaient sur des feuilles. Et en 2022, on a supprimé cette façon de faire et automatiquement, le système pouvait générer une liste électronique qui était ensuite envoyée aux équipes de paiement. Ainsi, ils pouvaient faire le paiement et payer directement via Momo, soit d'autres agences de paiement du pays. Merci.
It's okay. Thank you. Yeah, go ahead.
Concernant la deuxième question sur la micro-planification en ligne, nous aurions voulu, parce que dans le cadre de l'élaboration des micro-planifications, cela se fait dans chaque aire de santé, voire dans chaque district sanitaire et dans chaque département. Sauf que la méthode qui nous permettait d'élaborer ces micro-planifications était que chaque département devrait envoyer de façon, à travers un outil, à travers Excel, si je peux dire ça, à travers Excel, à travers une base de données Excel au niveau, les données de la micro-planification au niveau central. Et ensuite, au niveau central, on avait encore un deuxième processus qui consistait à rassembler toutes ces données-là et pour pouvoir établir une micro-planification globale du pays. Et donc, nous aurions voulu avoir une application ou, je ne sais pas, un outil qui nous permette de réaliser cette micro-planification directement et de rassembler les données directement dans cet outil-là pour que nous ayons plus à réaliser les deux processus qui consistaient encore à centraliser ces données-là, qui étaient bien sûr sujettes à beaucoup d'erreurs aussi. Et pour la troisième question, sur les MILDA, le scannage des MILDA individuels, là aussi je pourrais peut-être me faire appuyer par Jean-Michel pour la réponse à cette question.
Okay.
Alors,
Jean-Michel, go ahead, please.
oui, pour le scannage, en fait, on s'est rendu compte que les ballots de moustiquaires avaient des QR codes qui n'étaient pas, en fait, les moustiquaires n'étaient pas identifiés de façon unique, malheureusement. Ça, on s'est rendu compte une fois qu'on a mis en place l'application avec l'appui de Red Rose. Et donc, lorsqu'on scannait, l'objectif pour nous, en termes de traçabilité, c'était plutôt de différencier, de vérifier est-ce que les moustiquaires distribués sont réellement les moustiquaires de la campagne ou les moustiquaires venus d'autres, parce que Brazzaville, par exemple, est proche de la RDC, et souvent, il y a des mouvements de moustiquaires qui ont été constatés dans le marché et autres. Et donc, l'objectif pour nous, c'était, au départ, c'est vrai que c'était pour tracer de façon unique. Malheureusement, les moustiquaires ne sont pas tracés de façon unique. Et ça arrive par l'eau, malheureusement. Et donc, la traçabilité nous a permis juste de savoir est-ce que les moustiquaires qui ont été distribués, c'est réellement les moustiquaires de la campagne. Or, il y a eu, peut-être que c'est des moustiquaires d'autres lots, puisque à part la distribution, le pays fait aussi la distribution de routine. Et ces stocks sont gérés pratiquement par les mêmes équipes, donc les mêmes personnes au niveau des aires de santé.
Okay, thank you. I don't know, Sam, do you have any question to answer?
Yeah, I have a couple,
Okay,
couple of
go ahead,
questions, but I'll ask my colleague Samuel Ayoribe to answer this.
Good morning, everybody. Please, can you confirm you can hear me?
Yes.
Okay. My name is Samuel as well, Samuel Ayuribe, just like my colleague, and I'm going to be doing justice to the question. So I have the first question here on if the boundaries can be reused, like a typical example of grid 3. Now, just to explain that further, in the case of the geo-enabled microplanning work that was done in Bangladesh, and specifically for the EPI program. Now, I need to distinguish, if you notice in one of the slide, we try to differentiate within what is the political administrative boundary of the country and the programmatic boundary that we created. Now, because it's a programmatic boundary that we created to support the improvement of the microplanning, the programmatic microplanning, yes, the data over time being used would need to be updated, because once the data are created and being used on field, definitely it will reveal more problem or more challenges on the field. And in order to help improve the planning process, the next thing is to update the data. So yes, the data specifically at the programmatic level, which is the lower, which delineates the catchment of each area, yes, it can be improved. Just to also emphasize further, like you make reference to example of grid 3. For example, for Bangladesh, we currently don't have grid 3 data. But if you are in a country whereby there is grid 3 data, even if it's being created along for other programs, yes, other similar programs can access that data and see if it can be applied or used to their own microplanning process for planning and also for monitoring activities. Then there was the second question was on the reason why there is low adoption of GIS microplanning. Yes, I think the main thing is about capacity, right? For example, when we had to do this pilot in just 3 districts, for Bangladesh, there are 64 districts, and the pilot was done across what I would say it's about 3 districts. We first of all had to separately train what we call the surveillance immunization medical officers, who are by trade are not GIS experts. But because they work on the field, they work with the health assistants on the field, and they also know this area very well, and also they can catch up. We had to train them first for like 2 or 3 days. And usually before the workshop, we'll also have like a refresher daily training. So I would say one of the major reasons is capacity, because you need regular capacity in terms of, putting the data into use, updating the data, and, things like that. Also, the other side also is the technology also, you need some specialized software, which is also require procurement of licenses and things like that. There was another question about if there were problems with administrative overlap. Yes, I'll also address that on two sides because there is need to also clarify about the programmatic boundary data, which is the microplan data that were created. Now, on the political administrative boundary, you know, when you go to most of the country, you don't have this lower granular data that can help in planning, right? Then you have the higher level data by the government. Because what we're doing, we are not an authoritative mapping agency. Those data that the base data that we use and get from the government agency, we don't have the authority to tamper with it. But the lower data that we are creating, which is the programmatic data, which is being used specifically and only for the program, yes. One of the things is that by the time we started creating geo-enabled the microplan, and with the health assistants who are very familiar with the field and they do the work on the field, immediately they were seeing the problem. We see places whereby multiple teams are covering one catchment, whereas a particular team should be the one covering the catchment. We see problem whereby also, because in Bangladesh, we have the issue of flood. So we have small islands that has been eroded, and the particular population and settlements, they decided to move en masse to another area. So which means the team that should be covering that small island because the island is no longer there, nobody, you know, more like there is no accountability for them. Now, what that means is that where they move to, which shouldn't be where they should be on the microplan, they've basically increased the work of the team that is covering that location. So these are the kind of problem that we identify. In real sense, you might not say is exactly overlap, but it relates to things like, you know, population movement from one area to another due to one challenges or the other. But what the microplan exercise helped us to see is that we were able to see the picture as it is, right? And we're able to identify that, you know, these are the teams that should be covering them, but they are no longer covering them. These are the teams where their work has now been increased. And, you know, there were discussions because we were working with the Ministry of Health. We were working also with the Ministry of Local Government that is in charge of the health assistant workers. And when all those problems were identified, there were, you know, discussions on how to resolve it. And these are, you know, some of the benefits that the exercise brought. So I think that this also answers the question on the nomadic population. So like I said, for Bangladesh, not really encountering nomadic population, but what we encounter were population displacements due to natural occurrences like, you know, islands being flooded away and the population has to move.
Don't forget that we had the opportunity to interact with the speakers, and so we can ask and answer a lot of questions. That's my email address and my LinkedIn. Please feel free to send me any questions you have or connect. Just one warning, I'm a child of Ghana, and so for the Nigerians in the audience, I will not entertain any feedback on the proven superiority of Ghanaian jollof rice. Okay? We don't want to hear about. Thank you, my Ghanaian brothers and sisters back there. So let's get started. So what is ODK? ODK is an open source platform that lets you build powerful forms to collect the data you need wherever it is. It's used by researchers, it's used by field teams, it's used by other professionals to collect data that matters. With ODK, you can really do three things. You can build forms that include photos, locations, skip logic, calculations, external data sets. You can support multiple languages. You can have repeating elements. You can play videos. You can scan fingerprints. You can scan barcodes. And all of this works entirely offline. It's designed as an offline-first data collection tool. You can use the mobile app or the web app, and forms and submissions are synchronized automatically in the background whenever a cell or Wi-Fi connection is found. ODK is a data collection platform, so we don't do any visualization and analytics in the platform. Instead, we let you collect tools like Excel, Power BI, R, Python directly to ODK so you can build your live updating dashboards and reports. ODK has become a bit of a generic term, so I thought I would spend a little bit of time explaining what's officially ODK, what's part of the larger ecosystem. So we'll start with what I consider official ODK. So there's software that we make, the core team makes, like the ODK Collect mobile app, the ODK Central Server.
And then there are services like ODK Cloud, which is our new official, fully managed hosting service. It's really designed for professionals who need guarantees of speed, stability, and security. Then there's technologies like XLS Form and Enketo. These technologies are maintained by the ODK team. In the ecosystem, there are compatible servers like ONA, which is Matt across the way over here, tools like Kobo that use ODK technologies and provide a compatible service. There are white labeled apps. So if you've seen Kobo Collect or Espen Collect, generally any Android app that has Collect in the name that looks like a data collection app is usually a branded copy of ODK Collect. And then there are tools like ComCare, which is a fantastic platform, Server CTO, Server 123, that use ODK components in some way or another. They tend to be based on older components, so they're not entirely compatible. So that's sort of the larger ecosystem of ODK. There's tools like GTS, Red Rose, all those use ODK in some way or another. Most of my talk today is going to be focused on the core tools, so the official tools. So as of a few months ago, ODK is used by about 2 million people to send 250 million submissions every year. This graph is pretty up to date. So 193, basically every country except for North Korea has ODK active usage in the last couple of months. So it's pretty widespread now. ODK's strength is that it's a really flexible data collection platform, right? So it's not just a malaria tool or a polio tool. It's just a generic data collection platform. But most of our users are collecting very critical data. So example use cases like WHO using it for disease surveillance, Humanitarian OpenStreetMap uses it for field mapping, clinical research, crisis response, and more. So it really is used for a wide variety of use cases. You can learn more about these on our website. In fact, ODK is so proven for data collection that I have come to call it the Land Cruiser of data collection. It's sort of the standard, the way that things are done. Organizations trust ODK. Data collectors all over the world have been trained on how to use it. Managers know how to analyze ODK data. It runs on 22,000 different Android devices. It's been translated into 60+ languages. We support the Gregorian calendar, which everybody knows, but we also support the Ethiopian calendar, the Islamic calendar, the Myanmar calendar. ODK is used in cities. It's used in jungles. It's used at sea. Has it been used by a US politician? Yes. Jimmy Carter called it remarkable. Does it work in space? That's an oddly specific question. Yes, it's been used on the space station. I guess my point is over the last 16 years, ODK has been used by pretty much everything and everywhere, and it continues to keep going. Now I know what you're thinking. Yeah, I don't need to collect data in space. I am not an astronaut. I need to collect data on Earth, and preferably about malaria. That's a very fair complaint. And so I want to focus on a few success stories that show ODK use, particularly at scale for disease control. So the first is with Afro, WHO Afro, which has used ODK to collect about 500 million data points for disease surveillance and immunization. And the Afro team cites ODK as the key technology that helped eradicate polio in Africa. Another example in malaria is MOHs from LSHTM and Swiss TPH in partnership with MOHs used ODK to conduct the clinical trials that showed the safety and efficacy of the recent malaria vaccine. And then the last example is a typical use case. This is in partnership with DHIS2, where Uganda's MOH conducted a vaccine campaign that reached about 19.5 million children. And those numbers, like the 19.5, that's pretty typical for polio campaigns. So in any given year, there'll be tens of millions of children vaccinated with ODK-powered campaigns. So these are just a small sample to give you a sense of the reach and how ODK is used at scale. For disease control, I think of 5 key features that make ODK particularly good for these kinds of projects. The first, I think, is the most important, and that is ODK is really designed to be a flexible, lightweight data collection tool. So it's used for disease control, but it's also used for agricultural research. It's used for disaster response. It's used to run elections. So when you choose ODK, you benefit from all those investments from other domains. So a feature that's paid for by polio benefits malaria. A feature that's paid by election monitoring, you benefit from as well. And so not just the core features, but also the support on multiple devices, the fact that users are very familiar with the platform. And so as a government, if you choose ODK, you can apply it to whatever domains make the most sense to you. So all that results in a huge cost savings. And it's important to mention because I know that malaria is under some financial pressures. And so it's a great way to get efficiencies by choosing a platform that you can constantly reuse and is designed to be flexible. The second sort of key feature is that the forms are really powerful. They're very performant on very low cost devices. They're very easy on data usage. And these are features that they don't really show up on a checklist, right? But what I can tell you is that ODK does not have a marketing team. People find out about ODK because data collectors use it and find success with it, and then they tell their friends. And so that's how you know that the forms are powerful and intuitive. It doesn't require a lot of training, and people have success, especially with the recent versions. For those who are doing more geospatial work, and especially for those who haven't used ODK recently, we have a ton of new geospatial features. So this screenshot is of a base map. You can have custom base maps, offline base maps loaded into ODK. You can layer on top of that features, either points or shapes or lines, and you can navigate to those places. You can select them. You can use form metadata and feature metadata in your form filling process. So for example, if I know a structure is 10 meters high, I can ask a different set of questions than if it's less than 10 meters high. All that is available today in ODK. The way we connect to other platforms is two ways. For users can use tools like Power BI and Excel to connect directly to ODK. I'll show you examples of that in a second. If you're more of a developer, we have a great Python library that lets you automate everything that's available in ODK, and a REST API for those who want to do more. For the developers in the audience, APIs are sort of a term that people throw around. And I want to do a little side note here that most systems, the API is something that's like an external thing that the team produces for other people to connect to. And the problem with that is that because it's an external interface that the team doesn't use, it's not very good. And in fact, early versions of ODK, if you're familiar with ODK aggregate, use that model, and it produced a very terrible API, or API that was hard to work with. With the new ODK central server, we split the server into two pieces, a back end, which has the API, and the front end. The front end is what users see and interact with, but it's important to note that the front end uses the same API that developers have access to. And so in software development, we call it eating your own dog food. I don't like that term as much. I prefer drinking your own champagne. And so we use the same API that everybody else has access to. And so that's how I know it's a robust, fast, performant, easy to use, well-documented API. It's a very nice API. So it's very easy to connect to other services. And then the last thing, did I go back? The last thing here is flexible workflows. Historically, ODK has been used for point data collection, right? You go to a site, you do a survey, you come back, that's the end of the story. We have a new feature called entities, which I'm going to be demonstrating. And entities lets you collect data over time, data about people, places, things. And so the way it works is that you can visit a site, collect some data, maybe it's your baseline data, and in your midline or end line, you can use that same data as part of your data collection process. So things like bed net distributions are a really nice use case, and I'll show you an example of that. So it lets you do things like longitudinal data collection, things that look like lightweight case management, accept and reject workflows. And all these things are possible today in ODK. So I've been talking for about 10 minutes, which is a lot of time to talk. Rather than keep talking, I thought I would show you a quick end-to-end demo to show you what ODK looks like today, what some of the core features are, and just give you a sense of what it can do. This is going to be a little tricky because I've got a lot of monitors here. So bear with me whilst I get things set up, okay? All right. I didn't realize I was going to have a mic in one hand and another hand free. So we'll see how this goes, computing with one hand. So what you're seeing here are two things. On the side here, I have an Android phone that's in my hand. It's running a fresh copy of ODK Collect. So that's here. And then on this side here is the ODK Central Server. This is running on ODK Cloud. So I'm going to walk you through some of the UI of the server to show you some of the capabilities, and then we'll connect the phone to the server, collect some data, and show it to you, and go from there. So what you're looking at here is a list of forms within the central server. Central server has the notion of project spaces. So any given server, you can have as many projects as you want. Inside a project, you can have lots and lots of forms. You have a high-level sort of dashboard view of the forms that are being collected, when the last submission came in, how many submissions are there. We have roles and permissions. So I am very trusted on the ODK project. I'm a manager. I can do whatever I want on the project, add or remove forms. Ellen, who's our CTO, we don't trust her as much. So she only has project viewer permissions. So it's important to know that these users, we call them web users. They're back office staff primarily, people who have email addresses and these sorts of things, and they sort of manage the project space. We have another thing called app users. These are your enumerators, your field teams. These folks don't have usernames and passwords because that's really hard to manage at scale. Instead, what we have is this thing called app users, which have QR codes. The QR codes can be bound to individual people like Nick here. Nick is Nick's QR code, or teams of people. How you get the QR codes to your team is up to you. Oftentimes, teams print out the QR codes, they put it in the training room. You scan the QR code, you're good to go. You can distribute this over WhatsApp. And that's really powerful, right? If we have a project in Honduras with 50,000 enumerators, you do not want to manage 50,000 email addresses and passwords. So you could print it out per district or per team, put it in the training room, they scan it, and then they're auth to the server. So I'm going to do that. I'm going to use the San Diego team's QR code. I live in San Diego, that's why it's a San Diego team. We scan the QR code, and you can see that the phone is immediately bound to the project, right? The let's collect data with a cool emoji. Let's collect data. We put a lot of emoji in ODK, not because we like emoji. It's because it shows that you can do Unicode support, right? Accents, right to left languages. If you see emoji, chances are there's great support for Unicode in there. So what forms does the San Diego team have access to? I'll see that the San Diego team has access to household registration, household visit, and the sandbox survey. Great. And so if I go to start a new form, indeed, those are the forms I have access to. So all that stuff is being synchronized automatically in the background every 15 minutes or so. In fact, if I uncheck the sandbox survey and hit save, I go here and I refresh because I don't have 15 minutes, this form goes away. So all of the stuff is automatically managed in the background for you by ODK. Let's do a household registration. We've been reworking a lot of the UI in ODK to make it more usable and friendly to use. So I'm going to put in a last name. Let's go with Smith. Number of children, let's go with 123. If I swipe and go, it doesn't allow those things. There's logic and constraints built in there. And this is sort of the newest change we made to ODK. All that, the constraints and errors are done in line now on the newest versions of ODK to just make it easier for folks to use. So I'm going to go with a healthy 3. You see that questions appear and disappear based on the logic that I've programmed into the form. And now we drop it. If I have 0 children, I don't ask about the entrance. If I have 3 children, I do. Okay, I'm going to collect GPS coordinates. GPS in general ODK, about 3 to 5 meter accuracy. It depends on the quality of the device. You can connect external GPS devices, Bluetooth GPS devices. We have projects that get centimeter accuracy on. So if you really need really detailed GPS, ODK supports external GPSs that can get you really just crazy amounts of accuracy, like centimeters. This is a Google map. I don't like Google Maps right now because it's hard to see. So let's go ahead and change the mapping layer. We have a bunch of mapping layers that you can choose from. All of these have offline support. I'm going to use Mapbox. It's easier to see. So I'm going to get my GPS point again. And here, it's a much nicer GPS interface. I can see more stuff. So I'm going to select a location. This is fake GPS. So I'm going to just select a random location and hit save. That's fine. My GPS coordinates in there. Notes, live demo. Oh, typing not so good. All right, I've finished the form. I hit send. The Wi-Fi here is not great, but it should go. All right, let's go to the server here. Household registration, submissions. Indeed, 1126, we have a household submission from Smith, so the data has arrived. With ODK, we have a bunch more support for workflows, so you can filter by who sent the form, when they sent it. You can do things like say that I've approved this form. You can see an entire history of all the things that have happened to a form. So for example, I submitted it 11/28/6. It created an entity, which I'll talk about. It was approved. You can edit that data. Just call it the number of children to be 4. You can edit that data on the server. It'll redirect and ask you why you made changes to save, just like a demo. So for any submission, you actually have a long history of every change that's made to the form. This is really critical. A lot of people use ODK for offline clinical trials. And so knowing who sent the data, when they sent it, any changes that are made, ODK supports all of those, and you see every version. So every version of the form and the submission is available. When you're happy, you can approve it. We give you a lot of metadata for those who are bringing your own devices. You see which device sent the form, the device ID, just a lot of metadata. That's nice. When you're done, you can download the submissions as a CSV. But let's do something a little more exciting. So we've registered a household, but we want to come back, I don't know, next day to visit that household. So I'm going to go to household visit. I'm going to try to find a household. Let me refresh this form to make sure everything's up to date. So it's at select a household. So I registered some household previously, but I also have some households now. I'm going to zoom to my location and look at that. We have points. Is this the Smith family? Yes, that is the Smith family that we just registered. So I registered a household. Now I'm visiting the household. And that household, because I have geographic information associated with it, is now displayed on a map. So you can select households or entities from a list, like in a drop-down list. That's kind of boring. You can scan a barcode. That's a little better. You can pick them up from a map, which feels a lot better. I'm going to select it. You see that it has the status as blank. The notes that I collected about that entity, the live demo part, is in here. So I've selected the household. Did I deliver a bednet? I'm going to say yes, bednet delivered. I'm going to send that form to the server. I'm going to do another one here. Another one really quickly, zoom in here, maybe this guy here. That's Otieno. We'll say the bednet I did not deliver, send. Okay, so all that data is being sent to the server. And you can see if I go to the household visit form, let me just see if I can go back here. You see that in the background on the server, magical things are happening. So in the case of Otieno, I sent the form and then it saw that there was an entity associated with it. So it updated some of the metadata about that entity. And so when I go back here to do another visit, oh, I need one more, I think. Let me register. Bob. We'll skip these. Save it. When we go to the household visit, oh, it's crashing. Well, that's the challenge of a live demo. My apologies. I'll try to fix it whilst I keep going. But when you go to the household visit, the map that you saw with the blue dots, those dots update based on the status of that form. So things like if the delivery failed, the map would show blue. If the delivery succeeded, it will show green. And so as you're collecting data and you're doing these changes to the entities, all that is updated in the downstream tools as well. So the other thing I want to show you is that all the data that's being collected is actually available as a feed, a data feed that you can put into Excel or Power BI. And so I'm going to try to show you an example of that really quickly. I'm going to open up Power BI. This is going to be a little complicated because Power BI is actually running on a computer in San Diego. So we'll see how this works. So this is a map with some of the data that I've just collected. It's not up to date because I've been doing a live demo. So I'm going to hit refresh here. Apologies for the slowdown here because it's going a lot of places. So we'll see if it, there we go. We see that on the Power BI map, that's a delivery failure. that's registered, and this is the Smith one here. So the data that you're changing and updating is always available to you in basically a live updating spreadsheet or dashboard, and that's available today in ODK. So I'm going to pause here and go back to my deck and wrap up. Folks, if you want to try filling out this form, that's a short URL. And so you can fill out that household registration if you want to register some households, send it in, and then maybe during the Q&A session, we can see that updated dashboard. So Robert demanded that I talk about pricing. So I will do that. I will talk about pricing. Probably the most frequently asked question I get about ODK is like, but it's free. How do you eat? That's an excellent question. For a long time, ODK is an open source project. For a long time, we've sort of been funded by a combination of grant and volunteer work. But the reality of the situation is that it's very hard to produce a public good that's used at scale and to do it sustainably. And so a couple of years ago, we decided to offer ODK Cloud, which is a cloud-hosted solution, which is a turnkey service that you can pay a monthly fee for, and the ODK team sets up a server and maintains it for you. And I would say maybe about 10% of our users choose that option, 90% self-host. And so that 10%, because we have such a large user base, that 10% helps pay for continued work on ODK. So ODK is a financially sustainable project whilst being free, open source, community-oriented, et cetera, et cetera. Those of you who work on open source projects know that that is not a trivial thing to accomplish. And so we have a great community and a great team that's been able to make that possible. Hosting options. The first hosting option, so the ODK software, regardless of where it's hosted, is exactly the same. I mean, there's like minor differences, but fundamentally the same. So the first option is ODK Cloud, really designed for professionals who need fast, reliable, secure hosting. To give you a sense of how reliable ODK Cloud is, in the last year, we've had maybe 4 minutes of downtime, which is 99.9999% uptime. Extremely reliable. Support is provided by the core team. And so we have a lot of expertise in ODK. So it's 10,000 monthly submissions for $199 a month. If you want more submissions or power features, the prices go up for that. So this is starting pricing. We think it's very reasonably priced. If you don't want to pay anything, you can always self-host and self-manage ODK. So we call this ODK self-host. It's great for folks who are comfortable running Linux servers and providing their own user-facing support. Here, there are no limits. It's like whatever limits you want to put on your server, you can do that. It's self-hostable. I want to stress that ODK is extremely self-hostable. It's designed that way. So you don't have to have a lot of technical expertise, but you do have to have some to self-host. And you have to provide your own support or ask on the community forum. The forum has about 13,000 people on there from all over the world who are volunteers and can help if you need it. For folks who want something in the middle, we call this ODK Self-Host Plus. It's self-hosted and ODK managed. Starts at $19,000 a year. It's really designed for government or larger organizations who have a legal reason, for example, to host the data in country. It starts at 100,000 yearly submissions and goes up from there, unlimited project spaces. And it's primarily there for our larger customers who need to self-host for compliance reasons. So again, these are the pricing options. I'd say 10% choose ODK Cloud, 90% self-host, and all these are great ways to use ODK. All right. I don't think I get bonus points for going long. So rather than keep talking, I thought I'd pause here and see if there are any questions. Again, that's my email address. I respond to every email, which is not a healthy habit, but if you email me, you get a response. And if you want a more personalized demo, you can request one at getodk.org. We'll set up a 30-minute slot. We'll talk about your use case, and we'll step through forms and examples of ODK for your use case. So yeah, those are options that are available to you if you want to learn more about ODK. Any questions so far? Oh, we got a lot of good ones. Okay, I'm going to start to go from the front to the back. We have a lot of time. I'll try to pick up all those questions. The gentleman in green.
Hi, thank you very much. That was really interesting. Really appreciated the demo. I've got two questions, if possible. If there's not enough time, then just this one, which is that we work with lots of countries who do net campaigns, and we really support digitization. And we say, like, we really like the country to work together and digitize the campaign. We don't require any product solution. So it's for the country to decide. And we kind of make as much as possible the options that are available to them so that they can choose themselves. One of the arguments that comes back a lot is that they want to use DHIS2 tracker because it integrates into the national health system. And we say, okay, but do you know that all of the other ones, including ODK, you can still get the data into DHIS2? So I just wanted to know, like, what would your response be as ODK if you were talking to these countries who are, a lot of the time, my perception, and I don't know, I'm not an expert here, so I may be missing stuff, but my perception is that argument is the kind of trumping argument above everything else in the selection of the tool, whereas actually, again, my perception is that the primary concern should be getting a tool that gets them a good quality data set in the first place, and then integration into the national health system is, of course, extremely important, but that can be done after the campaign.
Yep.
That's question one. And if time for question two, but this is optional, could you just explain what the difference is between ODK and COBO, please?
Mm-hmm.
Thank you very much.
Very good. One more question.
Thank you. Thank you very much, Dr. Wu, for this great presentation. Do you hear me?
Yes, I can.
Okay. I am interested by the fingerprint talk about during your presentation, because I think it's more stronger as unique identification than the alphanumeric code we use. My question is, what equipment do you need to use the fingerprint? Can we use only a smartphone to collect fingerprint information?
Okay.
And the last question is, can we use the fingerprint reader to display some information which has been recorded before in the system?
Mm-hmm.
Thank you.
Okay, great. I'll take one more question and then I'll do in a batch. Yes, I think Ruben, right?
Oui, merci. C'est Nissi de la RDC. Je ne sais pas si je peux poser ma question en français. Aussi, in French.
No français. Oh, use the thing, right? Of course.
Bon, on peut avoir un traducteur.
I'll translate.
OK. Ma question est la suivante. Est-ce que ce n'est pas possible avec ODK de faire ceci? Vous voyez, dès qu'on remplit un formulaire dans un téléphone, si c'est possible, qu'on puisse avoir à la fin une synthèse des indicateurs clés de quelques informations dans un téléphone. Par exemple, si on voulait savoir le nombre de moustiquaires, des ménages qui ont été distribués qui ont été enregistrés dans un téléphone, qu'on puisse savoir, par exemple, tel téléphone a enregistré autant de moustiquaires, autant de ménages. Dès le départ, quand on tentait de concevoir le formulaire, s'il y a déjà des codes qu'on peut coder de façon que, à la fin de la distribution de la journée dans un téléphone, qu'on puisse avoir ces synthèses-là. Ce sont des indicateurs qui nous permettent, à temps réel, d'avoir des informations, des données qui ne sont pas encore arrivées au niveau du serveur. Parce que dans les pays où nous travaillons, on a vraiment un problème sérieux de connectivité.
Just going to make a quick translation.
Yes, thank you.
So my colleague here is asking to know if at the end of the form on one telephone, you could get, typically for a net distribution, the information summarized for the phone's forms, basically. So it's available before the uploads, which can be available later.
Yeah, okay, great. So I'll try to restate the question and then continue. So the gentleman's question is basically at the end of the form, I've collected some data. I want to use that data in essentially follow-up forms, perhaps for other devices on the campaign. Yes, that's what entities enables, is that as long as you do have a connection, that data that you collect on the local device can go up to the server and be redistributed to all the other devices. You're saying no?
I think the question was, because often they're working in offline zones.
Yes.
And so they've gone to, say they've gone to 45 households, or at least they think they have, but they'd like to know just at the end of the day, on their phone, is there a way for it to just give the summary?
There isn't a way to get a summary today, but in about a month, you'll be able to see on your device all the households that you've been to and the state of those households. So whether or not you've successfully distributed a BetNet or not, all that will be available either in a list or on a map so you can see that. So that's coming in a month or two. I'm going to try to do the other questions really quickly and then do more. So fingerprints, yes, it is possible with external hardware to scan a fingerprint in ODK and capture that fingerprint and then look up that fingerprint again to like open up a record. So fingerprint scanning is possible. It requires external hardware, but it's possible in ODK. The question about Kobo is a great one. So I want to split Kobo into two pieces. There's Kobo Collect, the mobile app, and then there's Kobo Toolbox, the server. Kobo Collect, the mobile app, it is exactly ODK Collect. It's about 3 months behind and has a different logo. So the only difference between Kobo Collect and ODK Collect is that it's slightly older and has a different logo. Kobo Toolbox is a web service that hosts your data and your forms. It is ODK compatible in the same way that ONA is ODK compatible. And so it will work with ODK just fine, but they have a different set of features than ODK's server. And so another follow-up question is like, well, why would I use Kobo versus ODK versus ONA? I think the primary reason that most people historically have chosen Kobo is that Kobo has always offered a free service for nonprofits. As of today, Kobo doesn't really offer a free service for nonprofits. They started to charge. And so I think if you're collecting more than 5,000 submissions, you will have to pay for Kobo. So that price gap between Kobo and ONA is different. Another reason, a reason to choose ODK today, you choose an ODK server today, is that ODK server is the only one that supports entities. And so if you're doing longitudinal data, if you want the Power BI support, the editing, all those are features that are exclusive to ODK today and not available in Kobo or in ONA. That may change over time, but as of today, those are the big differentiators. DHIS2, we know and love DHIS2 as a platform. I think in general, the question we get asked a lot is like, why would I choose ODK versus OpenMRS? Or why would I choose ODK over DHIS2? It really depends on your use case. If you are mostly collecting data for a district health information system, like DHIS2 is a great solution, right? If you are doing community health work and you're running a community health worker program at scale, CommCare is a great solution. But if the problem you're trying to solve is primarily about offline data capture and the flexibility that offline data capture gives you, ODK is a better choice. You can't always feed that data into DHIS2, but it does require an integration. And you can use something like OpenFN or Zapier. There are a lot of tools that you can choose to flow data from ODK into DHIS2. But ultimately, that is the trade-off that you have to make. Maybe a good example of this is like, we just shipped a printing from ODK inside the form. So you can collect some data about a household and then print out an ID or a summary of that data right from ODK's mobile app to a local printer. These are things that are sort of like niche features, but they're very important for some use cases. So if the problem is mostly offline data capture and you want a system that's flexible, it gives you a lot of language options, has a certain level of robustness and ease of use, ODK is great. If you're like mostly collecting district health information system or running a community health work program, there are purpose-built tools that work great for those. I think there's a question about like hardware requirements. So ODK requires a smartphone, and that's unlikely to change anytime soon. But we run on like 22,000 different devices. So chances are you can find an Android phone that's low cost that works. We don't have any feature phone or SMS-based support in ODK. I want to take the lady in the back.
Thank you. Thank you for the great presentation. I have a couple of questions here, but I'm particularly interested in the biometrics capture. So I understand that, like you mentioned, you need a hardware Is this specific, or can someone use any of the SDKs, or is it specific to the one you've integrated with the ODK? I just want that clear. Secondly, beyond collecting the biometrics template and storing it wherever in the central server, I'm particularly interested in the verification process, because most of these apps will be used offline at the community where sometimes there are no networks, and you might need to do verification of the biometrics you already collected. How is that possible? Or I just want to understand how is that possible, because that's particularly very important, the verification process of the biometrics that are already been captured and stored. I think the other question I'll have is about the user management. I don't know if that came out very well. So because you have a lot of users that are going to use the platform, and they're not using the platform independently, so they are linked to the health facilities. And there are quite a lot. And not just logging into the app to use the application, you need to also be sure that they worked, right? So that means each of them has to be created as a user within the platform. Is the application robust enough to handle that level of user management? Thank you.
So there are questions about biometrics and verification and user management. For the biometrics, we use an integration that our team built called Keppel. So I'm going to try to search for this here, but you can do it yourself. If you go to the Keppel GitHub, it'll show you what the requirements are as far as fingerprint verification. But yes, you can verify those fingerprints offline, and it explains all of that stuff in here, and the hardware that's required and all those kinds of things. So you should look at Keppel for that. For user management, there are like sort of many ways to manage users in ODK. There's a lot of flexibility there. But with the barcode scanning feature, you have to sort of understand that that feature is more about authenticating to a particular project space. So it doesn't necessarily identify a specific user. And so depending on how your project is set up, you might want to, within the form or on the device, have a user PIN or a user ID, something that's included in each submission, and then use that to sort of coordinate with whatever backend system that you have as far as user management. I know this doesn't give you a lot of great detail, but you have my contact information, and so you can email me and we can set up a call to sort of talk through your specific use case, and then we can talk about best practices about how best to do those kinds of integrations. I got to go to the gentleman in yellow. Sorry, I'll be here till 4+, so you can always grab me. Yes, sir.
Merci. Merci beaucoup pour la parole. Je poserai ma question en français. Je suis Rémi Ngoy de la RDC. Ma question, c'est de savoir s'il existe la possibilité de pouvoir connecter, de faire une connexion directe entre les serveurs ODK et les autres sources externes, les autres serveurs. Je prends par exemple le cas de MySQL PHP, MongoDB, ainsi de suite. Donc, s'il existe la possibilité, soit s'il y a un API, lequel? Merci.
Okay, I think the question here is connecting ODK to tools like SQL Server, Postgres, and these kinds of things. Yes, all those are possible. And the interface that we provide for that is the API. So for example, we don't recommend that you connect directly to ODK's internal database because that's an interface that changes over time. But the API is very stable and very flexible. So if you want to do things like pulling submissions from ODK and sticking them on S3, or pulling the submissions from there and putting it in another database where you process it, that's very easy, just a couple lines of code to get that kind of integration going. If you're not a programmer and you still want to do these kind of integrations, we have an integration with Zapier that lets you, with a user interface, select which forms you want to send the data from into another platform. So there's both options for developers and non-developers that work very well today. Gentleman over there.
Merci. Moi, c'est Edouard Mbungu de la RDC. Je pose ma question en français. Merci beaucoup. Oui, en fait, il y a un souci. On voulait juste savoir avec Odiki, parce que vous êtes la personne habilitée pour nous répondre à cette question, qui dire souvent on la pose. Lorsqu'on envoie les données, l'application ne nous donne plus la possibilité d'éditer ces données. But, à votre niveau, dans le système, est-ce qu'il n'y a pas la possibilité ou est-ce qu'il existe des lignes ou des codes pouvant nous permettre de donner la possibilité, une fois qu'on envoie les données, nous puissions avoir aussi, au cas où il y a des feedbacks ou des feedbacks terrain, nous puissions avoir la possibilité d'éditer de rééditer ces données-là et de synchroniser ça avec les serveurs. Merci.
Okay, I think the question here is about data editing. And I want to tease out because every ODK compatible platform does something different. So the ODK central server, which is the sort of the official server, lets you edit data on the server side as of today. So project managers, project supervisors can edit data on the server and only on the server. If you want to edit data as an enumerator or data collector, that is not possible in ODK today. But it's a feature that is actually on our roadmap and is coming in a few months. So today you can only edit data on the server. You have to have a project manager project manager permission to do that. And then in the future, enumerators will be able to edit their own data that they have sent. So that's what's available in ODK today.
Hi, thank you. So my question is about the compatibility of using ODK on Apple. It only works on Android. So why is that? And I hope you have plans to rectify that.
Okay, great question. I use an iPhone. Everybody on the team uses an iPhone. The reality of it is that ODK has a very small team. I think when I talk to people, they always say like, how big is the ODK team? Is it 200 people? Is it, how many people? There's 7 full-time people who work on ODK supporting millions of users. If you compare the ODK team size to ONA, Kobo, those teams are dramatically bigger. The benefit of that is that we can move very quickly and we can be very agile about the features that we ship. The downside about that is that we have to be very strategic about what features we build and how we serve the broadest base of people. So most projects that we interact with, iOS support is not a requirement. It's like a very nice to have. Building an entire iOS client takes an extraordinary amount of resources to build and to maintain over time. ODK is 16 years old now. I expect the project to continue for a long time. And so we are building a public good that is going to last a very long time. So we have to be very thoughtful about who we are serving, when we're releasing features, and how we do that. We do have support for iOS devices today within the web browser, and we'll continue to provide good support for like Safari-based data collection, including offline support that works today. We want to invest in that and make it better and better so we can support iOS and other browser-based things. But I think today, in the next 5 years, it's very unlikely that we'll be building an entirely new client and maintaining that client on iOS because the demand isn't as high. There are people who build iOS clients that are compatible with ODK. They're not very popular and they don't support the entire range of things that ODK can do. And that speaks to, again, the business case for it and the fact that it's really hard to build a client. The ODK client, the mobile client is like literally millions of lines of code. It doesn't seem that way, but it's a huge code base, one that we've been maintaining for a very long time. So again, I wish there was an iOS support, but the business case isn't there. And we have to be very thoughtful about what new things we release and how we can be responsible for those things for the next decade or 2 decades. Thank you. Other questions from the gentleman who did the translation, because I haven't heard from you.
Thank you very much. One thing that I've seen in other applications I was curious to understand for ODK is dashboards. I think it would be useful for the DRC context, for net distributions, for maybe local management of the health zone or the province to be able to easily access once the data is uploaded on the cell phone, a bit of the performance, maybe some anomalies in the data. What is available?
So I think the question is, once you collect maybe some household data locally, you see there's some issues with it, you want to be able to like edit it and keep it up to date. Is that correct? Yeah, those are functionalities that are part of the entities features that we started to roll out. And so right now it's still very early days. It's only a few months old actually. And so we are rolling out more and more features that allow for management today. As of today, you can mostly collect the data, see the data. You'll be able to edit the data soon, but there are more of these features coming. If anybody here wants to try these features, we have a community forum. I'm going to put it here. That has, like I said, like 13,000, 14,000 people on it. And so you should join that forum and you should participate in the development of ODK. ODK is unique in that everyone can participate in making it better. So if there's features that are missing or features you'd like us to remove, please let us know. We have a very welcoming process and a roadmap that lets us decide what features we build for the community. The lady in green.
In DRC, we start using ODK since 2014.
Oh, wow.
So in that time, ODK have a very problem with doublon. Doublon in English.
Duplicates.
Yeah. And right now, we want to start using code Kia for doing the traceability of the net. So do you still, can you stop that duplicate?
Can I stop that? So duplicates are a very important problem. I would say there are two kinds of duplicates in the world. There are true duplicates, and then there's like pseudo duplicates. So a true duplicate is, I went to a household, I filled out the form, I hit submit, then once it hits the server, there's like two of them, right? That is what I call a true duplicate, in that something in the transmission, something in the database went wrong, and now there are two records, even though I only filled out one record. That is impossible in ODK. Yeah, I shouldn't say impossible. It's extremely unlikely because every submission that you generate has a unique ID, and we only allow one ID in the server. So true duplicates do not happen in ODK today. Now, they are like pseudo duplicates. Like one data collector went to the house, filled out the form, and then another data collector came to the house, filled out the form. So it's two people who fill out data about the same thing, and now you have two records. So these are not true duplicates, but they are duplicates in a sense. And so the way that we want to manage that problem going forward is with entities, right? And so when you go to a household, you're not generating new data about the household, you're picking the household from a list that is sort of uniquely identified with an ID, and so you shouldn't have that kind of duplicates. So hopefully that answers the question. True duplicates are not possible, but other kinds of duplicates are possible in ODK, and so it's about the form design and using entities to help reduce that particular problem. Yes, sir.
The same question. Pendant la distribution dans un même téléphone, maintenant, il a par exemple scanné un QR code. Il répond encore à scanner le même QR code. Est-ce que c'est possible avec ODK de rejeter si le même QR code est scanné deux fois dans un même téléphone? Donc, je voulais dire quoi? Ça veut dire que j'ai un QR code. Je scanne.
Yes.
I scan the QR code. I scan, the same QR code I scan.
Yes.
It's possible to refuse to scan this.
Yeah, I get your question. If you're not using entities, yes, it's entirely possible for you to scan the barcode multiple times and send those records in. If you are using entities, and depending on how you design your form, then no, it is not possible because it'll see that you scanned it or you've otherwise done something with that entity, and it's no longer available for scanning. Does that make sense?
What is entities?
Entities is a new concept in ODK that let you track data over time. And so if you're using entities, you can sort of define an object or a thing, a person, a place, a campaign, that you have certain properties about that. And so you can say, like, I'm registering households and entities. Every household should have a national ID that's uniquely identifying. Every household should have some number of children. And so you've added a bit more structure to your project. And with that structure, you can have constraints that say, oh, you can only scan this barcode about this household once or twice. And so you can design new constraints and new workflows with this entities feature in ODK. If you're not using entities, then it's, it's the same flexibility you've come to love and perhaps hate, where you can do things that may not make sense for your particular project. Okay, gentleman over there, and then I'll come to you.
Thank you very much. I want to ask a question on operational phase. Suppose we are on the enumeration phase. Do we use a paper-based or is digital? If it is digital, what did you give to the head of the household? Is it a paper which has, of course, a QR code? First, I would like to know about that, and then I will complete my question.
Okay, it depends on how your project is structured. For a lot of projects, they print out, blank templates with a QR code and like a name blank and some other blank, and so they register a household by scanning that QR code, writing in the data about that household, and handing that barcode to the head of household as a registration step. So you can absolutely do that today. But you can also do it another way, where you go to a head of household, you fill out the name in ODK, and maybe you print a QR code if you have a printer and hand that to the data collector. Or you just go register the household, you take a GPS coordinate, some identifying information about that household, and that is sent into an entity that registers that household, and then it's available for use and recall later.
If you offer to the head of house a paper on which is printed the QR code, operationally, in terms of equipment, electricity, I think that we will need a printer, a small printer.
Sure.
So imagine in a whole country when we are using more than 10,000 sites to enumerate operators of enumeration.
Yes.
And then we use the same sites to distribute, which means that we will need such equipment, which requires, of course, electricity.
Yep.
Do you have an experience, or do you look forward how it can happen? And
yes.
How in terms of finance, equipment, how it may cost?
Yeah, these are great operational questions that really depend on the kind of projects that you're running. So we have some folks who are using ODK for in a biomedical context, where they're in a lab and they're generating samples, and there they have a QR code printer. They print it, they tape it to a vial, and they send it off for processing. For those projects, the printing feature works great. But if you're doing a project maybe at national scale, in a rural context, the printing is probably not a great idea. There, you want to pre-print the sheets that you're handing to people, cut them out, and then distribute them however you want. So the thing that's really important to note is that at ODK, we're not imposing any particular workflow on your country or your campaign. We're providing a set of tools that we think are broadly useful, that you can compose into things that make sense. So absolutely, if you have no power in the field, definitely don't use the printing thing. Print out the QR codes beforehand, cut them out, and then distribute them. If you are maybe in a lab context and you're doing biomedical research and you have a printer, fantastic. Then you can use that printing feature and it makes your work a little bit easier. We have a lot of documentation on our website that talks through some of these scenarios and tries to give you options that you can choose from, certain configurations that work in an online context and an offline context, and what those trade-offs are. Okay. The gentleman there.
Merci, prenez votre casque. Je poserai ma question en français. Je voudrais savoir pourquoi jusqu'à cette date, aujourd'hui, on n'a pas encore ODK dans le système d'exploitation AES. Et il se trouve souvent dans les contextes où on collecte les données, les gens qui vont aller sur le terrain utilisent eux-mêmes leurs propres appareils. Et souvent, il arrive qu'il y a des gens qui ont des iPhones. Donc, pourquoi on n'a pas l'application ODK dans le système d'exploitation AES? Et s'il y a des applications alternatives, donc il y en a, souvent on a peur de les utiliser parce que ce n'est pas des applications homologuées, donc tu peux collecter les données et les pertes. Est-ce qu'il y a des applications alternatives que vous pourrez conseiller? Merci.
Yeah, that's a hard question. Ultimately, I don't make the decisions on what countries use what tools. We just provide the tools and support wherever possible. So if there are features in ODK or tools that you want to use in ODK that you don't have access to, you got to escalate it up to whoever's in charge. And I'm very easy to find. And so if we can help support a country in rolling it out, we're glad to do so. But we don't decide what tools, we just make the tools available.
Thank you. We tried ODK in 2018 as a pilot in one of our campaign in some of it, the area at that time ODK was free. So now my question is regarding the payment in which you wrote $199 per month and stating 10K submission.
Yes.
So what exactly submission mean? Is number of beneficiaries or the person who is going to get the people registered?
Yep.
Secondly, if a volunteer is going in the community and making registration with a national identity card number, so that the person is coming back without any coupon or anything, so can they redeem the nets with the same ID card numbers, or do they have to have something in hand in their prints and then can be scanned?
Yeah, so the answer to your second question is yes, you can do that depending on how you configure the form. The answer to your first question is that ODK is still free. ODK has always been free. It will continue to be free and open source. If you host it on your own infrastructure, it's your labor cost and your infrastructure cost. So that has not changed. What we've added is an option for you to pay ODK to host a server for you, right? So we haven't taken anything away. We've provided an option that allows us to continue to make ODK. So if you use our infrastructure and you use our support services, we have to pay those people, and that's what the money is for. Now, the submissions. A submission is any form that you're filling out and sending in. So it could be a registration form, a visit form, any kind of form that you're filling, we consider that a single submission. Okay, great, thank you. I am so out of time. So I have another session that I think people are waiting for. I will try to do that session, and then I'm here till, all day basically. So please find me or send me an email, and I'm glad to answer whatever questions you have. Thank you very much for your time. I appreciate it.
Presentations, they're too small. Okay, cool. Okay. Cool. Go nice and slow. It's hard to read. Cool. Okay. Sorry. We're gonna get started. I need to mute this. Where is this? Sorry, I'm just trying to find my screen where I have this. Oh, here it is. All right, good afternoon. Thanks everybody for coming. I really appreciate it. My name is Matt Berg, and I'm the CEO of a company called Ona. I'm here with my colleagues Fuad and Alessandro. They'll be here later to help answer any questions you guys might have about what we present. So today, we're going to go over a little bit about kind of the toolkit approach we use as an organization to support campaigns. But then we're going to spend quite a bit of the time giving you a preview of a new service called Pixel that we've created that we think might be really helpful for micro and macro level planning. If you have any questions, I used to teach, just raise your hand, interrupt me, please. I prefer you ask and then wait to the end. And also before you leave, please come and get a sticker for this if you want. Okay. So just really briefly, as an organization, we develop tools that help organizations use data to improve service delivery. We have three kind of main platforms: Ona Data, which is an ODK kind of based tool. This is used a lot by groups like WHO, UNICEF for a lot of their campaign work. It was a primary data collection tool with ODK Collect for the polio campaigns in Nigeria, as an example. We have Akuka, which is a data viz platform, and OpenSRP, which is a digital health platform for community and facility-based health workers. So using our kind of ODK approach, we really believe in sort of a toolkit approach for that. So instead of building one system that does everything, we really think it's better to pick your data collection tool, use tools to bring your data into a data warehouse, and then visualize that with whatever tool you prefer. So using this methodology to build real-time monitoring systems, we've supported a lot of initiatives. So we supported UNICEF. They've developed a toolkit called RT-VAMA. And RT-VAMA basically has been used by UNICEF to respond to different types of outbreaks. So in the Philippines, there was a polio outbreak, and then there's a measles outbreak more recently in Papua New Guinea. So they use this tool to distribute using ODK, putting it into a data warehouse, a very quick response, building dashboards, and then using it to map coverage rates for the Philippines. We also develop technologies that are for frontline health workers. We think this is linked to campaigns. I'll explain that in a minute. So this is an example of an application for child immunization that we've developed that's for countries like Zambia. We also have community health worker apps that are used in places like Liberia, Bangladesh, Uganda, Indonesia, etc. And we also have a geo widget. This came out of work that was funded by the Gates Foundation called Reveal, and where we've added the ability to visualize like a geo widget where you can go house to house, select that household, and then enumerate or collect information on the household members. So this is really good for, we were using it for indoor residual spraying campaigns, for bed net distributions, for mass drug administrations, different types of use cases. And then using the same kind of data collection approach, we could feed that into dashboards and provide real-time monitoring down to the household level where you're using like the households as a denominator for coverage in your enumeration area. The last little bit on this is we really are we really think that it's important to think about the problems we're doing and the role of campaigns from a system standpoint. So we work a lot in immunization. We support UNICEF, Ministries of Health there. When we were involved in work in Zambia doing IRS, we mapped about 1 million households with ACROS. And we collected the number of children in that house, the number of women of reproductive age. That information that was never linked back, and Zambia never used it for their child immunization program, right? Which I think is a big shame. So a big part of it, we think of from a system standpoint is, if you've been given the investment and the mandate, you're serving the people of your country in your whatever country you're working in. Maybe it's for malaria, but how can that work you're doing in malaria be used to benefit the same kid that needs a bed net also needs a vaccine? So how do we use that same information you collected from a bed net distribution and make that available for routine immunization programs, for community health program, and vice versa? If there's a community health system that's already registered where children live, or the number of sleeping sites, how can you use that to have better information when you're planning a bed net distribution, as an example? So we think there's a lot of role for connecting these tools together. And that's going to allow us to, if we care about zero dose kids, as an example, have a better way of getting to full coverage by linking these systems together. One other quick use case that might be relevant for for the malaria use case is around supply. So we've also developed using the same platform, a tool with UNICEF called End User Supply Monitoring. And what we've done is, so UNICEF procures a lot of the supplies for health facilities across Africa. So they might procure, for example, like Plumpy'Nut, which is a nutritional supplement, or maternity kits, or motorcycles. So it comes in, they buy the goods, they hand it off to the ministry, and they know where it's supposed to go. So this tool basically allows them to say, we sent, 4 beds to this maternity, and then this tool allows us to basically assign those beds to that place, and then it creates a simple tool for a driver of UNICEF, the Ministry of Health staff, to go click on the facility and say, cool, these things are in stock. So we're using this in Madagascar to really good effect to understand kind of our supplies reaching their end destination. So you can say this maybe for bed net distribution and other techniques, a very lightweight, simple way to track whether your supplies are going to where they need to go. The last little bit is we also, using toolkit approach, have developed a tool called Akuko. You'll see it later today in our presentation. And this allows you to basically build kind of data portals, dashboards using maps from different data sources, and to develop different types of things. So here's an example of like a dashboard that contains text, kind of like the New York Times, which is really helpful if you're sharing information. You send somebody a dashboard, they want a presentation instead because your boss won't understand what the dashboard means. You need to explain in words and charts. This allows you to basically build a presentation like a report that's powered dynamically with your data. So that's kind of why we built it. It allows you to tell stories of data. So, in this case, it's water points in a slum in Nairobi. So you can see kind of where they work. You can see which ones are broken, why it's broken. So tell stories of data and tell stories with information. It also then presents the output of your data. So this is a portal we developed for UNICEF that allows you to do that. And then for micro planning, we're using the same methods to develop really nice maps that link to data. So you can build tables of your views. And this is just like a screenshot showing a bunch of health facilities and communities for UNICEF in Mozambique. And they use this for some of their planning around campaigns. Cool. All right. So today, the main thing we want to talk about is a new product that we're working on. And we'd love your feedback. So you see problems, if you're excited about it, let us know. We're calling it Pixel. And the idea of Pixel is we want to create a grid of the world that's 1 kilometer big for the whole world. And we want to combine different data sources together on it. The reason why we want to do this is right now there's a wealth of new information, data sets that are available that's really, really powerful. So one of the great products out there now is called World Pop. Have you all heard of World Pop? You know what it is? So World Pop is high resolution population density maps. So basically they take census data, they take satellite imagery of where people live, they combine them together to try and estimate where your populations are distributed. So it's a tool that a lot of groups use for planning to give you, because you might be getting your district data, at the district level, your census. This allows you to see how are those people spread out within that district. There's also other products and data sources that are supported by donors that are also very valuable. So this is one that I was just made aware of by some colleagues from Burkina Faso. This is of the Gambi, or it's a vector, I think, Anopheles gambi vector. And why this is relevant for insecticides or for bed nets is this helps you inform what treatment to use on your bed nets, depending on the resistance of the malaria in your country. So in Burkina Faso, it's interesting, if you kind of see it right here, half the country is in one vector, half the other countries in another. So it's actually really relevant for them to understand what treatment to use. The point here is this information's out there. It's really nice, but it's presented in this format that's kind of like a photograph. That it's called a geotip or raster data. So it's really useful, but you have to be a GIS expert. You have to download this file. This file is about a couple 100 megabytes big. You have to load it into your GIS tool. Then you have to know how to get data out of it for it to be useful. There's also a lot of other data sources that may not be related to malaria, but still are really relevant if you're working in health or any other sector. So this is one called FuseNet. It's funded by USAID. And what they do is they provide predictions of what food security looks like for all across Africa and Southeast Asia, et cetera. We worked a lot in Somalia, so this is a very, very valuable data set for us to understand which communities were different, where we supported have projects, what is the food security status in those areas. So this is another data set that's out there that's really helpful, but it's on this one website. You got to go there and download it and integrate it into your own analysis. So Pixel, what we want to try and do is, can we take all those different data sets that are out there and combine them around a unique 1 kilometer square called a pixel, and then combine the different data from those different places and link it to that common pixel. Okay? So that's the idea. So in this case, you could have admin boundaries, you could have population, and I'll show you some different use cases here. The way it works is basically we divide up the world in little squares. It's something called a geo-index. And this came out of like the mapping technology. So I don't know if you remember the original Google Maps. It was kind of looked like, it was like actually images that they generated. They were static images. So the first map of the world you saw, if you went to Google Maps when it first came out, was 4 images. If you zoom in, it became 32 images. So if you do this and you keep zooming in, you could actually get down to like 1 or 2 meter accuracy for the whole world. We have billions and billions of these tiles. So what we've done is we've selected the level 15, which is the equivalent of 1 kilometer. Why this is useful is that it basically provides us a methodology for, we're basically taking information and assigning it to a numeric value, which we can calculate using math. And that allows us to separate analysis where you need a GIS tool into a database, a tabular Excel even, which you can do in a very, very fast. So doing database queries where you're aggregating data is much, much faster than doing it using a GIS tool. So just a little bit about the methodology, and then I'll show you the actual tool for creating a pixel. So this is an example of Uganda. So we take Uganda, and then we divide it up into these squares. And they're not random squares. They're actually based on that quad key, right? So they're uniform. So you could generate that same square using any kind of software and know you get that same shape for that same place. We then take a centroid, which is the middle point of each square. And we do these 2 things. So with that, once we have these grid in place, we can then convert raster data, which is the data that looks like a photograph, which is very high resolution. And then what we do is we count like all the little dots. Each of these little dots is the population, and each one of them has a value. So one dot might be like 5 people, another dot might be 50, another might be 7. So we just sum up all those dots and then assign that to that pixel as a population total. So we've counted up how many little dots are in that 1 kilometer, do it. For other types of analysis, like the food security one I showed you, that's what we call vector. So it's more of it's like we assign classifications to an area. In this case, we can intersect using the centroid to extract the data out for that place. So I'm explaining just a little bit of the methodology for what we do here, okay? So now I want to go and actually just want to show you the tool. Okay, wonderful. Okay, so let me just actually do one. So this is available at geopixel.xyz. It's very alpha. We just launched it literally last night. So so if you have problems, please email us and let us know. So the idea here is basically, I'm presenting you Nigeria, but this is using the meta population data set. We haven't done world pop yet, but we've been able to add in, some different countries for here. So, but we're going to use Nigeria today as our example. Okay. So starting off, I have a map of Nigeria. And what we do is right now, if I click on it, I can see that each of these squares are quite big because I'm zoomed out. Okay. So right now it's about 50,000 people. So what we do is as we zoom in, we basically start showing more and more of these layers. It's a little bit slow because of the internet. But eventually you get to the pixel resolution. So now we're at this is the 1 kilometer area. And if I zoom in then, You can then you can start to see what the populations are. So you see like the numbers from the coming out here. You see the coloring. But we've also taken the Google Maps and Microsoft building layer, which is about 3 billion buildings. We've counted all the buildings in each of these places, which you can visualize here. And you can use that then. So we could count the buildings and assign that to that pixel. Okay. So there's a lot of, I think, interesting use cases which we could talk about, even just for seeing where people are. Like there's a satellite mode we can switch to. So you can kind of see like, hey, I see there's, some people here, turn on the passage a little bit, what's going on over here? Let's see. Okay, looks like there's a cluster of people. Cool. So you can even just identifying where people live, it's kind of useful. Okay. All right. So I've shown you population. So one of the things we want to do is we want to make it easy to do things that are hard for, you have to be a GIS expert to do, right? And we want to make it really, really quick. So one of the first things we've developed is using this approach is if you want to see a population for an area, you can click on this little thing here. Let's say I want to see it for Bauchi. And I can just draw a shape around it. And then very, very quickly, I just got the population count for that area. And I also got the distribution of population for this. And so number of women, number of children, number of youth, et cetera, women of childbearing age. So this is very fast and you can kind of move it around and kind of get different counts, et cetera. So that's kind of one of the things that we're trying to do. The other thing that we're doing here is we're making available, like I mentioned, it's not just population, but it's other data sets, right? So one of the data sets we added as an example is drive time. So this is basically how long it takes to access a health facility from any location. So the areas in red this is like areas that are basically, if I click on it, it would say that it's over, yeah, it's like 200 minutes or something to get to that health facility. So we've added basically the ability to see your distance to a health facility. We brought in, for example, malaria incidence rates. That's kind of vector data. The parasite rates. So this is from the Malaria Atlas project. Again, so it's sort of taking that information that was sort of in that information, and now I can click on any point and then get the malaria rate for that point. And then also I brought in the food security data, which I showed you also. So if you're planning a project and you want to see, you're doing a campaign, this would help you understand where the populations might be more stressed for food security issues. So now that we've done this, so it's a way to explore data. We also want to make it possible to use your own data to get information out of it, right? So we've supported a couple of different geospatial functions that are built into the tool. So one of them is we call point enrichment. So you might have a list of settlements or facilities that you're working in. You can upload it or upload a file, click submit. And what we're doing is we're uploading this to Pixel. And then we're quickly, now we've mapped these on the map. And then for each of these points, we've added the data from the file you uploaded and we've enriched it, right? So you can go here and you can now export this back out in Excel or GeoJSON for your own analysis. Let me explain what we've done here. So this is what I uploaded. I uploaded a latitude, a longitude, and the health facility name, right? And then what Pixel has done is we've then added in automatically the population for that area, the number of children, the admin area. So we also do geocoding for you. This is based on kind of standardized boundaries that we have, but if the country has their unique ones, we can also add that place, the malaria rate for the country, the number of buildings, et cetera. So this is a really nice way to do point extraction. And like I can show you one example of how that's useful. So we've done, this one, sorry. So in this case, I uploaded a whole bunch of settlements. Oh shoot, I didn't save it, for a country, and then I can visualize it in this tool. Okay, so I could, for example, now calculate on average how many. Is it in here? Oh, what the average drive time is per facility. All right, so let me just go back to this. Cool. So the other ones that we support is you have the ability also to do polygon enrichment. So for example, I might have places I want to work. So here, these might be catchment areas. I'm just going to draw one quickly to add it to the map, right? Now I'm going to, get out of here. I'm going to export this file. So these are like catchment areas. I'm going to go back to Pixel quickly. And upload it. So now what we're doing is we're uploading it, and then we're basically calculating the population for each of those areas that I just did, and also the average malaria rate, the drive times, things like that. So you see now you have the analysis here. What's also nice about this is you can then, it creates a unique URL that you can share. You can send it to a colleague, and then this will pull up again, the image, and then they could download that information and access it themselves, right? So one of the use cases is, for example, I took, this is there's another really great tool called Crosscut from Cloyd, who's here, and it allows you to draw catchment areas. So what you could do is you could take a tool like that draws the catchment areas, upload it here, like which is what you see here. This is in Nigeria. And then you could see, we can add, for example, the other information, population, whatever the information you want to your admin areas that you design yourself, okay? So if you're planning a campaign, you can say, cool, let's load it up. Let's add the population, let's add malaria risk, let's add distance to the health facility, but then use that for maybe better planning for which catchment areas to prioritize, as an example. And then the last one that we support is kind of buffers. So we're just going to do one more. A lot of times, if you say you have settlements, you want to know roughly how, or a health facility, you want to know how many people that health facility serves. A typical method is to generate what they call a buffer around it. So this tool will allow you to create a buffer of, like, for example, I'm doing 15 kilometers for that place. So uploading it. So now you see we've created these, and we've also split them. This is a method so that basically ensures that you're not double counting between these locations, right? So now for each of these places, you can extract what the populations are for these places, etc. Okay. So the goal here is really like, how do we expose this information? How do we make it easy to enrich your data? And how do we make it easy to do, pretty complex analysis in your browser without needing to be a GIS expert and share that information? But then you could take it and put it into your own BI tool, your own analysis tool for further analysis or visualizations as you want. I think that's so just kind of one other thing that we've also added, I just want to show is sorry. So one of the things that is useful about the fact that this is multi-dimensional is that we have malaria, we have population, is it allows us to see information more clearly, okay? So if I presented this to you right now, say you're an analyst in Uganda, and you're tasked to figure out where do I send our campaigns? If you just had this map, what would you do? So red is malaria. Which area would you prioritize? Probably the big red area on the map, right? Okay. So which is true, but if you then add in population to it, right? Now we can start to see malaria and population together. So we see this area that we were worried about actually doesn't really contain a lot of people. But Gulu is like, which is a center of a lot of there's a lot of refugee camps, for example, has a lot of people and a lot of malaria. So it allows you to really start to see, for example, where there's lots of malaria and a lot of people, and where there's a lot of people and not a lot of malaria. So this kind of dimensionality in terms of understanding and visualizing data is also really useful for planning. So we've also added that into this. So if you wanted to see, for example, let's look at the malaria incidence rate. I can go down here, click on centroids, and now we've normalized this against the populations, right? So you can start to see where there's high amounts of malaria and high amounts of people, et cetera. So it allows you to get a better sense of how population affects or are affected by these different, things, or, food security or access to health facilities, et cetera. So, yeah, just please. So you can, but at some point, in terms of showing like at the pixel level, if you have like the visualization methods are not really available beyond 2, it's getting difficult. You won't be able to understand it. But you could add in other contextual layers. If you want to show where your settlements are, where health facilities are, you could add that to these kinds of maps. But the main thing is it's really about allowing you to upload your data, enrich it, export it, and then do analysis, or use a tool like this for trying to understand better what's happening. So, like one other example is we have, just in terms of like the scale, anyway, we can do like the whole country in like 2 minutes, in terms of analysis, et cetera. So anyway, so this is sort of what we have to date. We hopefully would love to get your feedback if it seems like it's useful. Sorry, there's one other type of thing that we think is also exciting about this, right? So for example, we have a state right here, Bauchi. It's kind of hard to see, but that's like the outline of it. One of the things we can also do now with this type of tool is if you wanted to say, I want to know the number of people in every state in Nigeria that fall within like 2 hours away from the health facility, within 1 hour, within 60 minutes, within 30 minutes. It'd be really quite difficult as an analyst to figure that out, right? You basically have to create a grid and do the sampling method to do that. So this makes it very, very easy for a non-technical person to do that type of analysis, right? So I can say, if for every state in Nigeria, give me a chart showing the breakdowns of people by each of these stratifications, as an example. So this also, we think, will unlock different types of analysis, which might be very handy for your planning. We could also say, show me the settlements that are in red. So we could extract, if you draw an area, and you can say filter by like red or green, we could also extract the values that are found in each of those pixels. So these are the settlements that are at risk based on whatever criteria you design, et cetera. So another use case, sorry, then I'll answer certain group of questions, is, for example, it's maybe hypothetical. If we have elevation and we have malaria rate, we could give you the average malaria rate per 50 meters of elevation in the country if you wanted to, with this type of analysis. Let's hand it over to questions.
Yeah, I just wanted to know if it is a public good, if the tool is a public good, like open source.
Sure. So it's a public service. Right now, we want it to be the data sources. So right now, the software is very simple. So the main thing we're trying to do right now is make this available through this website and learn how it's useful for people, right? And then there's a lot of this is a curation. So creating scripts to automate extracting data from these different places and making it available at scale. So how do we take all the world pop data and make it available here for decision makers? It's like something we're trying to figure out. So the value for you is going to the site. Right now, there's no cost. We want to make it, free for a lot of use cases. But we would love to figure out what the use cases are for countries. Like in the last session, I think somebody from Nigeria said, this is wonderful, but we would want to include a lot of our own data sets that are private, that we would not want to be public, right? So could you make this available to a Ministry of Health for planning with their own private data sets? Because we could also use the same methodologies for your own data. It doesn't have to be public data sources. So right now, for us, it's just about does this seem useful? What are the kinds of data sets you would want to see? What are the kinds of analysis that would be helpful to you? And more importantly, the people that are doing the planning at the district level that may not be GIS experts, examples, right? So that's sort of what we're trying to do here. Yes, please.
The bank will only recognize UN pop data.
Sure.
And so I was just wondering why.
Yeah, I mean, right now we're just using the data sets that are out there. So Meta has one. There's WorldPop. WorldPop is the one that's probably most used in development practices I've seen. Depends. So that's the feedback we need. So there's another data set, Zambia is releasing their own one, I believe, soon. So like it's just about making available. A lot donors are spending a lot of money investing in these. But you have to go to that site for that one project, extract it and try and use it. So yeah, so we're really agnostic on the data source. We just want to figure out, we want to show you where it comes from and the caveats of use and let people decide whether it's helpful for them or not, at this point. So yes, please.
Okay, yeah, I think it's going to be very useful for a lot of analysis. But in relation to the first question, now yes, there isn't meta population density data, but on this, can you combine multiple population data to get more accurate population estimates? Is that possible? Also for countries that have probably done their recent population census or enumeration data from campaigns and like, can you upload this and the application will be able to get more accurate data? Then the second bit also is because a lot of analysis is going into place, right? One thing we see from gridded data is once you get the satellite imagery data for settlement boundaries and points of interest, sometimes it's need to go on the field to maybe update the settlement name or the health facility name and things like that. So my question would be, are you able to, if you have a master list of this, can you upload onto this? And yeah, I think that because that would be also be very great in terms of analysis to ensure that using the accurate data. Yeah, I think this is just.
Yeah, great question. So yes, we can upload using the same methodology. So one of the things we did, I don't have it done today, is we took all the grid 3 health facilities for Nigeria. And then so we counted how many are in each pixel. So you can see a density of health facilities. You also could click and extract the health facilities there. So one of the things we could do is grid 3 has good settlement data populations. So we could also use that to say, what pixel does it fall in? Let's take that population and let's build a population map based on the grid 3 settlement data, right? As an example. Now, methodologies, we have to figure out if it makes sense, but that type of thing would be possible with this approach. Yes, please.
For health campaign or like immunization, you use ODK for the data collection at the lowest level. Is my understanding correct?
Yeah, we used ODK. We have another platform, OpenSRP, that has the mapping pit. So we do both.
So yeah, I was thinking an integrated campaign, like a measles campaign, in a given day, there will be like 3,000 kids that I use a tally system.
Yeah.
How do you do this? Is it like you take a scan of it, or you're in the ODK or whatever system you're using, you're actually noting down one person at a time, and that would take a lot of time.
Yeah, so there's different and again, this is where we're getting into this like exploration approach, right? So in the past, what we've done is we've enumerated catchment areas, and then we've counted like how many buildings are in that catchment area. And when we visit a building, we base coverage on how many percent of households visited, right? Like that's one approach. Another approach could be a little bit less robust, but maybe still practical would be if you take a method like this, where you're saying in that square, we know that there's, say, 500 children. And if I'm dropping points, if I've done survey data and I've registered 400 children, like if I register 400 children to households in that square, then I know I have 400 out of 500 roughly assigned to that area from a coverage perspective, right? Again, it's not perfect. And again, maybe that household is really in that other one. But if you average it out over a couple pixels, you probably start to get a decent view of what, assuming that population data is accurate, of what your coverage rate would be for a campaign. So you could even do this for buildings, right? So the buildings might be more accurate, saying there's 300 buildings in this kilometer area, and I have the GPS points. I can tell you how many of them fall in that same place. So you can figure out what percentage of buildings were visited in that one square, right? Instead of drawing out each one manually, which is what we also do for campaigns. So this is like that denominator question. And is this useful for that? That's a question I don't know. So right now we've just done Nigeria as an example. We've done populations though we can do it pretty quickly, like we did Peru, US, I think Zambia, South Africa, Tanzania. So we want to have the populations one done for the world pretty quickly. And then it's really going to be based on demand. So if a country says, hey, or maybe we'll do the malaria one for a bunch of countries. I don't know. Really, we just want to know, like, we want to see if this is useful before we spend a lot of time, building it out. So a lot of it will be really based on demand. So. Yes, please. Yep.
For countries, especially when you're looking at the malaria data or surveillance data and the like, they might not want to make this publicly available for one reason or the other.
Yep.
So the question would be, can you download the graded data locally so that you can do your analysis, or is it at that point where there will be some cost or something?
Yeah, so I mean, that's at some point we have to figure out a way to pay for it, right? So whether a donor helps or there's a business model for some kind of payment. So this is what we're trying to understand, right? So we want to make something like this available for free for use for a lot of use cases. But if a country wants to, maybe we could have a private version where they get access to all the public stuff, but they could upload their own data securely. And we could also say we could help digitize, like for example, we're using admin boundaries from the UN, but countries have their own admin boundaries too. So they say, we want to use, or we redistrict, Uganda redistrict like 2 years ago. So we want to make sure we're using the new district data, right? So in that case, maybe we'd work with Uganda to say, cool, what are your private data sets? You might have a lot of household data you want to put in there. So provide them a private way to do this themselves. But we love that feedback.
Merci beaucoup.
Merci.
Pour la micro-planification, pour déterminer la population, c'est les gens qui vont sur le terrain pour le capturer, ou bien c'est par satellite qu'on le simule. Là, c'est la première question. Et en termes d'interopérabilité, comme maintenant on parle d'intégration des données, les pays utilisent déjà certaines plateformes pour collecter les données de routine, et y compris les campagnes. Quelle est l'interopérabilité de telle manière? Ce que vous avez présenté tout à l'heure, c'est vraiment génial. Si je collecte déjà avec DHS2, que je puisse l'amener pour mieux faire les analyses, pour sortir les résultats qu'il faut. Est-ce que c'est possible?
OK.
Merci.
Donc, pour la première question, c'est avec WorldPop, juste pour montrer. Je ne suis pas l'expert, mais l'idée, c'est qu'il prend les bâtiments de satellites, puis il prend le data de census, puis ils ont they have the methods to combine them together, saying, so we have, this district might have, say, 1 million people, and then we have like 800,000 buildings. So let's spread out that million population across those 800,000 buildings. So they try and anchor it against the census data for the country. And then how they distribute where those 1 million people live based on where they see people are on a map. So that's how they develop these maps. That's the methodology. For your second question, it's a really great question. So one of the really exciting things about the reason we're using the indexing is that I can give you a GPS point, and I can tell you very quickly what pixel it's in, right? So you can say, here's my GPS point. I did a household visit. Tell me the malaria rate in that household, right? Tell me the district it's in. Tell me the whatever information you want using this methodology, right? So one use case is in some countries, they have sickle cell anemia. And if you give somebody ACT for sickle cell, then they will get very sick. So some places you have to give them an extra test for an enzyme, the test if they have sickle cell. And if they have it, you have to treat them with a different form of malaria treatment. So you could share your location and say, where am I in the country? Is there high prevalence of sickle cell or not? Because in a couple of places in Africa, there's very high prevalence. Should I test? That's a very hypothetical example, but you could do things like that. So.
Et si on a fait la microplanification,
Oui.
La distribution des moustiquaires, par exemple.
Exactement.
Si on veut faire la distribution des moustiquaires ou bien la distribution des médicaments dans le cas de SMC. En termes de la précision, si nous avons ce problème-là, comme je vous ai dit, cette année, nous avons fait la campagne. Je ne mets pas le problème sur l'équipement de l'agent de nombreux, mais je me dis aussi l'application est un peu fautive. On se retrouve, je suis au Togo, mais le MENA qui est au centre se retrouve en Chine. D'autres se retrouvent dans la mer après Brésil. Est-ce que cette application permet d'améliorer la qualité ou bien c'est toujours lié à la qualité de l'équipement?
So this helps show this population data as an example is not perfect. So what we can do is we can make it available for you to use, and you can validate it with it, right? I think the real potential though is how can you bring in your own country data? If you do a campaign and you want to do a new campaign, right? How can we use this to build you a map based on the number of households that were visited in that area, but in a way that might be a little bit easier to see and analyze for future campaigns, right? But blend it with the data that's in these kinds of sites to kind of provide verification. I'm not sure if I'm answering your question very well. I think the key thing is that the information that you're capturing in campaigns are very, very valuable. And I think the question is what I showed you today. If we assign those values to, like, say, pixels, would that be helpful? And we could access these other tools. Would that be helpful when you're planning your next campaign, as an example? I think that's something worth exploring. I don't know the answer, but it might be potentially useful. Yeah. Yes. Okay. Sure. So this is not a data collection tool. But if you give me, But if you give me your GPS point, I can tell you where it goes. Okay. So that's the idea here. Just as a side note, I think it's like I was looking at Peru yesterday. Even if you're just doing basic planning and you want to see like where where are people, it's kind of cool because you can be like, okay, I see some okay, I see that there's something here. So let's go in here and let's see if there's any buildings, right? So in this case, it didn't detect any, but let's go up here. I see there's a house settlement, and these are bad examples. But even just a way to highlight where you might find people is kind of cool, so anyway. So I think we're at time. So I just want to thank you very much. If you have any more questions, please come up. If you'd like to use it, again, it's geopixel.xyz. We would love for you to try it, give us your feedback. If you do try it, if you can just take my business card and send me an email. I'd love to do that. Sure. Thank you. Okay, wonderful. Also, if you would like stickers for yourself or your kids, please come and get some stickers. Yes, please. Thank you very much online.
Yes, take him. Help yourself, please. Bring them home. We have plenty. Okay. Yes. What did you do? I used to go. What did you do? I'm the one that have hey, so they're like pack up. How does it so
Good. If I can ask everyone to take their seats, we'll start our last session. So the session is titled Digitization of Health Campaigns, Challenges and Opportunities. And it's a great pleasure to introduce the Director and Program Manager for the Impact Project and MEP Nigeria, Philip Okoko. So welcome, Philip.
Thank you, Jason. And good afternoon, everybody. So if we just settle down, we are gradually winding down this two-day meeting that started yesterday. And like we normally say, the end sometimes are the best. So the very best is being reserved for the last. We are looking at digitalization of health campaigns, the challenges and opportunities. And this is a session that we started earlier in the day. So we're continuing with it. And this afternoon session will be in two different compartments. The first part will be dealing on integration. And we've often talked about issues around integration, how that is able to bring in things like cost efficiencies and all whatnot. So I want to learn from other people what has happened so far. So to begin the session with us this afternoon, I'll be inviting Elvis Mwanza. Is Elvis in the room? From DRC. As well as Sakibu Alassani from HISP WCA. So they'll be leading us in the first two sessions, and I want to enjoin the presenters to please stick to time. We've been racing against this time since we started, so let's just build in some time efficiencies as we take our presentations. So I'm going to immediately invite Elvis to take the stage. He's going to be talking about pilots of integrated digitalization and digitalization approach in DRC, and with reference to the polio campaign. You're welcome.
Thank you very much. Hello, everybody. So I think for my presentation, I will do it in French, and I apologize for this. OK, merci beaucoup. OK, merci beaucoup pour la parole. Bonjour à tout le monde. Je m'appelle Elvis Chibassou. Je viens de la République démocratique du Congo. Et je représente ici l'Agence nationale d'ingénierie clinique et du numérique de la santé. un ICLS sans cycle, qui est l'une des structures importantes pour la mise en œuvre de la couverture santé universelle en RDC et dont l'une des missions importantes est la transformation digitale de tout le système de santé de la RDC. Je m'en vais ici vous présenter assez rapidement un retour d'expérience de la digitalisation des campagnes de santé contre la polio dans la province du Haut-Lomami. Alors, en guise de plan de présentation, je vais aborder l'introduction juste en fixant quelques aspects de contexte dans lesquels justement le projet de digitalisation des campagnes intégrées a été mené. Je vais m'en aller assez brièvement aussi vous présenter le projet justement de digitalisation des campagnes, présenter assez brièvement l'approche qui a été adoptée pour la mise en œuvre de ce projet et aborder aussi la mise en œuvre de la digitalisation proprement dite, telle qu'elle a été mise en œuvre contre la polio, et aussi présenter quelques défis, leçons apprises et recommandations formulées au terme de cette expérience pilote de digitalisation de campagne dans le Haut-Lomami. Alors, le Haut-Lomami, en fait, est une des 26 provinces de la RDC qui est un pays situé au centre de l'Afrique et qui compte 519 zones de santé, 5 missions de aires de santé et plus de 12 000 établissements de soins de santé répartis dans les 26 provinces. Et la population estimée en RDC est d'environ 95 millions d'habitants. Ce sont là les chiffres de 2022. Et à ce jour, nous sommes autour de 100 millions d'habitants avec un taux de croissance annuel de 2,9. Et la province du Haut-Lomami, quant à elle, est située au niveau, du moins au sud-ouest de la RDC. Et elle compte, quant à elle, un peu plus de 3 millions d'habitants. 16 zones telles que le paludisme notamment, qui constituent les premières causes de morbidité et de mortalité. Et dans ce contexte, les campagnes de masse constituent un des moyens préventifs importants pour justement adresser cette problématique et permettre d'atteindre toute la population et même celle qui est la plus éloignée. Mais seulement dans ce contexte-là, les expériences de digitalisation sont quand même assez limitées. C'est la raison pour laquelle la RDC a initié le projet de digitalisation de campagne intégré, bien sûr, avec l'accompagnement de ses partenaires techniques et financiers, avec comme objectif de numériser et de digitaliser et d'intégrer les activités de campagne de masse dans tous les programmes de santé de lutte contre la maladie. Et en termes de provinces prioritaires, le choix avait été porté sur la province du Haut-Lomami. Évidemment, ce choix est justifié par plusieurs critères, entre autres la prévalence des maladies, tout comme la rougeole, le paludisme et la polio, les initiatives antérieures, tout comme le paiement mobile des prestataires des campagnes, ainsi que des données existantes de cartographie sanitaire, tout aussi la sécurité, la situation sécuritaire. Alors, pour arriver ou parvenir à cet objectif de digitalisation, juste un moment. Alors, pour parvenir à cet objectif de digitalisation, un cadre de gouvernance a été mis en place pour justement faciliter, je dirais, l'alignement et la coordination des différentes initiatives de digitalisation. Évidemment, quand on parle de structure de gouvernance, cela passe par la gouvernance, par une création d'un groupe de travail qui a permis éventuellement de piloter la mise en œuvre de ces activités de digitalisation de campagnes de masse. Alors, toujours par rapport à cette approche de digitalisation de campagnes de masse en RDC au travers de cette expérience pilote, un plan de mise en œuvre avait été élaboré, qui avait été finalisé, validé par toutes les parties prenantes, mais aussi une budgétisation de ce plan de mise en œuvre avait été effectuée, et ce qui a permis d'établir, par exemple, les différentes responsabilités des différentes parties prenantes à ce projet de digitalisation. Mais aussi, toujours dans le cadre de cette approche, il y a eu une identification et la sélection de l'outil justement de digitalisation, ainsi que des différents partenaires techniques de mise en œuvre de cette expérience pilote. Il s'en est suivi le recrutement des partenaires techniques et de mise en œuvre, mais aussi le lancement officiel du projet, qui avait été précédé d'une visite pour voir en fait ou étudier le contexte dans lequel le projet devait être mis en œuvre. Cela au niveau de la province du Haut-Lomami. Et le projet pilote en lui-même avait été mis en œuvre entre la période de juillet et novembre 2023. Et là, ce sont les 6 ou les 7 grandes phases ou étapes de cette approche qui avait été mise en place et qui, à partir de ce jour, toutes ces activités ou toutes ces étapes ont été évidemment achevées et les aspects de renforcement des capacités d'extension ainsi que d'intégration de l'outil sont à ce jour en cours de réalisation. Alors ici, vous avez une vue d'ensemble de la mise en œuvre justement de cette activité de digitalisation de campagne au niveau du Haut-Lomami. Évidemment, c'était une mise en œuvre effective, mais avec des défis, bien sûr, à relever, notamment au niveau des infrastructures, parce qu'au niveau du Haut-Lomami, la réalité est, par rapport aux infrastructures, notamment les infrastructures routières, les routes sont quand même assez dégradées, ne rendant pas très facile le déplacement d'une zone de santé à l'autre, ce qui, quelque part, entrave aussi la mise en œuvre justement des solutions digitales en santé. Au-delà de ça, il y a des réalités qui sont liées aux contraintes de connectivité. Par exemple, dans le Haut-Lomami, le taux de pénétration en ce qui concerne l'Internet tourne autour de 41%, mais aussi il y a des réalités qui sont liées aux aspects d'électricité. Et par rapport à ça, le taux de pénétration, par exemple, est de 15%. Donc, nous comprenons par là que le Haut-Lomami n'est pas un environnement ou une province où il est facile de mettre en œuvre les solutions digitales. Alors, en termes de méthodologie, toujours dans le Haut-Lomami, 2 zones de santé pilotes ont été choisies, à savoir la zone de santé de Kamina et de Kabundu Dianda. Au niveau de la zone de santé de Kamina, 24 aires de santé ont été ciblées. Et dans ces aires de santé, 71 356 individus ont été ciblés pour la vaccination. Et les équipes qui avaient été mises en place pour justement accompagner la mise en œuvre de cette digitalisation de campagne. Au niveau de Kamina, par exemple, 210 équipes de vaccination ont été mises en place, 99 superviseurs de proximité ont été mis en place, 5 superviseurs de proximité ont été mis en place et 200 cellules d'animation communautaire ont été mises en place également à Kamina. Au niveau de Kabugondo Dianda, 26, là je ne vois pas très bien. Excusez, juste, on doit bien rattraper les diapos. Donc voilà, je parlais de Kabondo Dianda. 20 aires de santé ont été ciblées et 60 126 individus ciblés pour la vaccination. Et en termes d'équipes, 212 équipes de vaccination ont été mises en place, 102 superviseurs de proximité ont été mis en place. Excusez-moi, il y a vraiment un problème de défilement des diapos. Ok, désolé pour cette petite interruption. Donc, j'étais en train de présenter justement comment est-ce que l'organisation de la mise en œuvre justement de cette législation de campagne au niveau des zones de santé pilotes dans le Haut-Lomami, notamment pour les zones de santé de Kamina et de Kabondo Dianda. J'en étais à présenter les différentes aires de santé ciblées au niveau de Kabondo Dianda. Donc, 20 aires de santé avaient été ciblées éventuellement et 60 126 individus avaient été ciblés pour la vaccination et 212 équipes de vaccination mises en place pour justement la mise en œuvre de cette digitalisation de campagne en termes de vaccination. 102 superviseurs de proximité, 5 superviseurs d'axe et 242 cellules d'animation communautaire. Et par rapport aux outils utilisés pendant ce projet pilote, nous avons justement le DHS2 qui avait été justement adopté pour mettre en œuvre les différentes activités de campagne en termes de digitalisation. Et pour ce qui est tout ce qui est suivi et évaluation, nous avons l'outil ODK qui avait été utilisé et le JTS pour le suivi des itinéraires des équipes. Alors, pour ce qui concerne la structure des équipes, il y a eu une équipe de coordination en charge de la coordination de toutes les activités de mise en œuvre de digitalisation de campagne. Bien sûr, c'est Annie Sénès qui a présidé cette équipe de coordination. Et au niveau de chaque zone de santé pilote, notamment à Kamina et à Kabondo Dianda, il y a eu justement des responsables d'équipe pour chacune des équipes qui étaient en charge de la mise en œuvre des activités sur le terrain. Et par rapport à chaque zone de santé, il y a eu des superviseurs indépendants qui avaient été recrutés pour accompagner la mise en œuvre de la digitalisation. Et bien sûr, au-delà de ça, il y a eu des relais communautaires qui avaient été également considérés pour la mise en œuvre des activités de la campagne. Alors ici, c'est un peu comment est-ce que la coordination avait été organisée. Donc, sur place, il y a eu des micro-plans qui ont été éventuellement récupérés et un plan de déploiement avait été élaboré. Et sur place, pour pouvoir adapter ou s'adapter par rapport à la situation telle qu'elle s'est présentée sur place, sur le terrain, il y a eu des ajustements de calendrier pour adapter les différentes interventions de digitalisation par rapport à la planification de la campagne de masse qui avait été prévue. Au-delà de ça, il y a eu la gestion de contrats ainsi que la relation avec les partenaires qui avaient été facilitées par la NICNS, justement pour pouvoir voir dans quelle mesure les différentes activités pouvaient s'aligner par rapport à ce qui avait été prévu dans le cadre de cette digitalisation. Au-delà de ça, il y a le développement de matériel de formation ainsi que la configuration des tablettes. Ça, c'est l'une des grandes étapes dans la coordination pour pouvoir mettre en place des guides de formation sous forme de procédures opérationnelles standards pour pouvoir permettre aux personnes d'être facilement formées. Alors, il est important ici de préciser pour ce qui est de la digitalisation dans cette diapo que 790 tablettes, 790 tablettes avaient été mises à disposition pour pouvoir digitaliser les campagnes de masse contre la polio dans le Haut-Lomami. Alors, avant le déploiement sur le terrain, l'outil DHS2 avait été testé, et cela dans une zone de santé de Kinshasa, la zone de santé de Kikimi. Cela a permis de savoir un peu plus comment est-ce que cet outil se comportait en termes de fonctionnalité, en termes de fiabilité, et les résultats avaient été concluants, ce qui a permis à ce que nous puissions avoir quelques leçons apprises en termes de formation complète à tous les niveaux, qui étaient quand même impératifs pour permettre une mise en œuvre réussie de la digitalisation, la sélection des agents ainsi que l'évaluation des infrastructures existantes. Alors ici, nous avons les différentes étapes pour de la mise en œuvre justement de cette campagne. Qui a commencé en fait par une visite sur le terrain des différentes autorités, justement pour pouvoir faciliter leur implication dans le projet. Il y a eu des aspects de formation, il y a eu aussi des aspects justement de configuration des différentes tablettes sur le terrain, de recrutement des différents superviseurs indépendants pour pouvoir accompagner les différents infirmiers titulaires sur le terrain et faciliter pour cela la vaccination ainsi que le dénombrement sur le terrain. Et ici, il est important, par rapport à la mise en œuvre, de souligner que la mise en œuvre avait été effectuée sur un temps assez court, soit 2 semaines environ, du 1er novembre au 18 novembre 2023, en tenant compte de ce qui avait été planifié en termes de campagne de masse contre la poliomyélite. Ici, je m'en vais assez rapidement, comme il me reste quelques 2 minutes, présenter assez globalement les résultats. La digitalisation telle qu'elle avait été mise en œuvre dans le Haut-Lomami a permis de dénombrer 64 000 personnes sur 43 aires de santé, donc ce qui fait un taux d'exhaustivité d'environ 95%. Et au total, 117 594 enfants avaient été dénombrés de 0 à 59 mois. Et il y a eu quelques disparités, évidemment, dans les résultats. Donc, 36% des aires de santé dépassaient les 100% de la population extrapolée. 25% des aires de santé ont enregistré un dénombrement de la population compris entre 90 et 100%. Et 39% des zones de santé avec une population dénombrée à 90% de la population extrapolée. Alors, pour clore mon intervention, je vais aller directement sur les différents défis et recommandations. Alors, en termes de leçons apprises, la première leçon, en fait, c'est de comprendre le contexte particulier de la RDC avec l'importance cruciale d'une planification globale à tous les niveaux. Et la deuxième leçon, c'est de garantir la disponibilité des équipements de digitalisation des infrastructures robustes. La troisième
même temps une occasion pour l'équipe nationale d'automatiquement comprendre les défis ou comment utiliser la technologie. Alors, dans un premier temps, l'équipe technique, déjà DHS2 dans le pays en termes de configuration. Mais maintenant, en ce qui concerne la formation, cela est fait de deux manières. La première option, c'est-à-dire nous le faisons pour la formation des formateurs, à ce que cela soit en présentiel. Et maintenant, façon cascade, eux, maintenant, ils iront vers les utilisateurs finaux pour aller rapidement leur montrer quoi faire. Mais bien entendu, pour certains besoins, cela peut être fait en ligne, comme cela a été fait pour le taux, ou pour ceux-là qui devaient faire la collecte réelle, c'était fait en présentiel. Par contre, pour ceux-là qui devaient faire la collecte pour les données de stock, c'est-à-dire la partie logistique, eux, cela a été fait rapidement en ligne parce que, bon, il y avait des problèmes de temps pour rapidement rassembler sur le même endroit. Mais en RDC, cela a été fait aussi de façon présentielle, de façon cascade. On forme les formateurs au niveau national, ils descendent vers les régions. Next. OK. Alors, quand il en vient maintenant de pouvoir intégrer ces données de campagne proprement dites, soit cela a été cocktailé dans le même système que le HMS, surtout quand vous êtes en face des données agrégées. Mais quand c'est plus en termes de données beaucoup plus granulées et puis la hiérarchie sanitaire n'est pas la même chose, donc on est dans ce cas obligé de venir utiliser des outils de transfert de données entre deux instances de DHS2, un peu comme ici DHS2 Transfer App qui a servi à celui du Togo par exemple, mais aussi dans la dernière version de DHS2 maintenant, il y a, à partir de la 2.39, il y a déjà un outil intégré qui va permettre rapidement de créer des liens entre vos différentes sources de DHS2 que vous avez. Donc, lui va vous permettre maintenant de prendre rapidement les données qui ont été collectées de façon individuelle dans les instances campagne pour rapidement les envoyer dans les instances de système de santé national qui existaient pour pouvoir faciliter les analyses. Allez, suivant. Next. Alors, lorsqu'on arrive à faire cette intégration, cela va nous permettre de pouvoir comparer les données qui ont été collectées de façon campagne et les données qui étaient déjà collectées de façon routinière. Alors là, ici, nous sommes en face d'un graphique où on essaie de voir pour tous les 12 derniers mois des 2 années, 2023 et 2022, en ce qui concerne palu confirmé. Et là, on le voit déjà qu'en novembre, la verte est celle qui est récente, mais on voit déjà que la courbe était basse. Mais la courbe était basse, next. On peut ici voir que ce qui est en bleu est ce qui a été collecté de la façon campagne. Et on peut aussi un peu interpréter qu'après que la campagne s'est passée, les données routinières aussi ont eu un impact parce qu'il a commencé par avoir une diminution. Donc, l'idée ici est de montrer que plus vous envoyez les données de campagne vers les données routinières, vous pouvez rapidement avoir certaines interprétations en ce qui concerne la qualité ou plutôt l'impact de ce que vous avez. Next. Alors, en termes de perspective ou de bienfaits, c'est que quand on essaie d'intégrer ces données, on pourra faire les analyses de façon longitudinale, on peut croiser les données qui proviennent de différentes sources, que ce soit de DHS2, mais aussi de différentes campagnes liées à la même vaccination ou plutôt des vaccinations de différents programmes aussi peuvent être mises au même endroit pour des analyses. Alors, oui, next. Alors, et l'un des bénéfices ici, je pense que ça, c'est pour le cas de la RDC. Le cas même de la RDC aussi était un contexte intéressant pour pouvoir faire une collaboration entre non seulement nous en tant que HISP, WCA, mais aussi HISP basé en RDC et HISP Centre pour pouvoir apprendre plus des problèmes ou plutôt pouvoir développer de nouveaux modules en ce qui concerne DHS2 pour mieux soutenir les campagnes dans les pays. Et donc, cet aspect de polio nous donne au moins une idée de ce qu'on doit pouvoir faire pour améliorer. Et pour ce faire, il y a eu un tableau de bord plus spécifique, NEST, qui a été développé pour pouvoir aussi, non seulement vous avez le tableau de bord pour les DHSDA de façon standard, mais il y a aussi ce tableau de bord intégré au DHSD déjà, qui permet aussi de mieux montrer, basé sur les besoins vraiment aussi du pays, comment est-ce que les campagnes en train de se passer. Et cela, on peut switcher entre plusieurs vaccins automatiquement avec le même. Voilà, c'était quelques exemples de la RDC toujours, mais mon confrère a déjà parlé de cela. Next. Et donc, en conclusion, on peut dire que voilà, c'est vrai que beaucoup de pays sont en train de se tourner vers le DHS2 pour régler les données de campagne. Et cela, on comprend que pour certaines complexités, ça peut amener à créer des DHS2 parallèles, mais il y a toujours la possibilité de pouvoir joindre. Vu que ce DHS2, ça devient encore plus natif, de pouvoir intégrer ces approches. Et là, on veut aussi que le cas d'utilisation de la RDC qui est en train de se passer, où nous allons pouvoir lier, que ce soit maintenant un cas d'utilisation qu'on pourra répliquer dans les autres pays qui seront intéressés. Merci. Thank you.
So thank you so much for keeping to time. Even though we've gained a little time, but I think we should just go ahead, and at the end of it all, we'll take questions. So our presenters, please remain seated. The others will join you shortly. So I have the pleasure of inviting these other groups of persons that will be taking the next round of presentations. Segolin of PSM, alongside Ruth Hattersley of AMF. The next presentation to this will be done via Zoom. I want to believe that Emiliano of PSI is online. Can you confirm that you can hear us? Emiliano. Okay, I want to believe that he's online, he or she. I also invite Rukari Medat from Uganda to join the team up here. And last but not the least, Chipo Ngogoni from WHO. And I would still recommend, please, if you optimize time for us so that we give enough time for questions and answers. So I'll invite Segolin or Ruth. Which of you is taking it first to start?
Thank you. Before I start, I'm going to borrow something from earlier in the week. If anyone feels like standing up or stretching, you're welcome to just take 10 seconds before we start. Lots of interesting things to listen to coming up, so just take a second. Some great stretching going on. Okay, thank you. So yes, I'm Ruth from Against Malaria Foundation, and I'll be presenting with Segolin from PSM Zambia on the use of digital tools in Zambia's mass campaign and how that was used to improve visibility. So what do we mean by digital tools? We're principally talking about electronic proof of delivery. So that's, oh, I'm just introducing, if they can make it come. Or do I need to wait? Go ahead, okay. So what we're talking about when we say digital tools is electronic proof of delivery. So that's waybills coming by email or on a platform, GPS tracking, and some use of barcode scanning. So we'll be talking through why was this looked at, what did we try to do, what was implemented, and what did we learn from it. And really importantly, I'd like to mention Noah Mtonga. He was originally going to present today. Unfortunately, he couldn't make it here, but we wanted to mention him because he's been so integral to both this work and to deliveries across the Zambia campaign. So we wanted to appreciate Noah and his work before we start. Can we find the slides? I'll carry on. So the context for this initiative was that in the previous Zambian campaigns, there had been some problems with knowing where nets were, with being able to report quickly on whether deliveries had arrived, the exact numbers, being able to react to changes requested, and being able to read documents clearly. I'm sure many of you are familiar with the kind of documents that can come through that can be very hard to read. And often you don't know exactly where nets have been delivered to or how quickly you can add them up and account for the total numbers. So this isn't unique to Zambia, but it was one of the things noted that could have been improved on when we came to the 2023 campaign. And the 2023 campaign, of course, led by the NMC, was supported by the Global Fund, PMI, and AMF. And today we're talking specifically about the PMI AMF provinces where this initiative was carried out. Just this picture is worth noting just to remind us of the scale of the deliveries that take place for a mass campaign. And here's an example of a kind of proof of delivery that can be really difficult to read sometimes. And delivery planning, as we talked in previous presentations, by paper. So what were we trying to do with this initiative? The main aim was to increase visibility of nets. Where were they in the process? How many had been delivered? Had the right number been delivered? Were any further corrections required? To improve the processing of documents, could we quickly check the documents from suppliers, get them paid, move on? Overall, improve the traceability of where nets were in the system. It's also worth noting, this was an opportunity to capitalize on the work that's been done by TraceNet, which Chris talked us through this morning. I'll also mention there was a fundraising element. AMF's model, as you heard from Julian yesterday, is that we have individual donors funding nets. So the 6 million nets for Zambia were funded by over 5,000 people. And each of those can look and see what stage their net's at in the campaign process. So real-time reporting that is enabled by the kind of tools we're going to look at, it's not necessary, it's not needed for every campaign, but it's an exciting opportunity to improve the way that this is done, to make it easier for the teams involved, and to overall improve the confidence of both the country teams and donors watching their nets move. And I'd like to add that's not necessarily a negative thing. It doesn't necessarily mean donors are saying, has my net got where it's meant to go? It can really be a positive thing. It can be about engaging donors, getting them excited about the fact that their nets are moving towards recipients. I also really should mention that this whole opportunity to explore technology like this was absolutely possible thanks to the support of PMI and especially the enthusiasm of the NMEC for trying out new digital tools. So I'll hand over to Segelen, who's going to talk us through what was done in this campaign.
Thank you, Ruth. So from the GHSC PSM perspective, what we committed to do was throughout this campaign to put local actors in the lead and threaten local systems. So we had to find and identify local service providers able to respond to specific requirements. We wanted them to be able to use an electronic proof of delivery platform to transmit POD in real time and support all hardwares, licenses, data, and other associated costs for this platform within the fixed price subcontract. We identified 3 service providers with the requested capabilities. So the digital tools were effectively included in the subcontracts. We reduced the risk of poor performance by assigning a primary service provider and using the others as backup. We had 3 service providers, so we were able to distribute simultaneously in different provinces. And finally, we were able to negotiate distribution rate per province. Next slide. When it came to the distribution itself, on the ground, the drivers were equipped with devices and data so that we could track in-transit orders throughout the live tracking app. We were also able to receive the e-pod as soon as they were issued and signed by the recipient at the health facility level. The bells were consistently scanned at the point of dispatch, and there was a plan to scan them when they arrived at the district health office and at the health facility, but we had to scale back on that plan. Those 2 pictures are basically showing the bells being offloaded from a 30-ton truck coming from Lusaka and reaching the district health office. They were then split into smaller orders and loaded in smaller vehicles and directed to the health facility. The second picture showed the bells arriving at the health facility and the e-pod being signed off so that we would receive basically the information right away. So what went well? Basically, the e-pod application gave the project full control of the in-transit and delivery process. All events and deviation was captured as they occurred. Deliveries were more accurate, reducing over deliveries and the need for reverse logistics. There was no need to train the drivers on the e-pod system since the driver were already used to using them. And we avoided cash flow issues that can happen with local vendors as we were able to speed up invoicings and payment of deliveries. It also removed paper handling and potential tampering, which added securities for commodities, and we had no report of any net loss. However, we did encounter some challenges. So from time to time, the PODs were either delayed or did not come through email automatically. There was a significant portion of barcodes that were either damaged or unreadable, so that impacted the scanning from the point of dispatch. And while we had planned to scan the barcodes at loading and offloading points, we had to drop off the letter due to time constraints. We were also only able to trace the bell and not the individual nets. And we had a limited pool of local vendors with e-pod experience to choose from. Now Ruth is going to talk about the recommendations and way forward.
Great. So firstly, there were a number of practical recommendations that we would make to anyone who was doing something very similar to this in the future. So firstly, when ordering nets, discuss barcode sticker quality with your supplier. When we went back to the supplier in this case, talking about the nearly 8% of barcodes that weren't usable, they immediately had suggestions for improvements they could make to the materials used. Flag this early to suppliers and be clear that you need very durable stickers. Next, allow more time to identify new transporters, and for that process of choosing transporters to take longer. I've heard different views on how widely available this kind of technology is. It certainly won't be an option for all countries, but even in countries where it does exist, it will take longer to engage with transporters and make sure the systems are suitable. Next, definitely conduct dry runs. This is both, so by dry runs, I mean testing out the scanning technology, and not just testing the technology, it's also about testing the process in the warehouse. Where do you do the scanning? Where do you move the bales? Lastly, do lots of cross-checking, particularly at the beginning, to check that the POD system is being used correctly. Here I say we've written cross-check of digital versus scanned. That means when a POD comes through, there's typically the digital POD and it contains a picture of a scanned POD. So it's just about checking that the two match up. Lastly, I think there's a number of more lessons to learn in terms of what one could do in the future beyond what we did here. So firstly, individual net traceability. We only scanned bales barcodes, and there's a lot more that you can do by scanning net labels instead. Maximum traceability would be scan everything, but we know that there's a lot going on in campaigns, and if you're thinking about scanning something, you need to start with why. What are you trying to achieve? Which part will be most impactful for your distribution? Live reconciliation of barcodes. So by that, I mean, we scanned everything on every bale as it was loaded. We scanned some bales as they were delivered. We didn't cross-check. What we were using the scanning of barcodes for in this case was essentially validating the net number that was declared. So if we said 1,000 bales were loaded, there had to be 1,000 barcodes. And there was software used for scanning ruled out the possibility of duplicates. So that's a pretty simple use of barcodes. We weren't doing the piece where you check across, and that would give you another level of authentication. It's worth mentioning that would give you another level of another task to do and another thing to reconcile, and it would again take up time and attention. Finally, you can do more to use the GPS data collected. That's nothing we've done in this case, but if you went and scooped it up, there'd be a list of all the GPS coordinates of all the health facilities in the provinces concerned. And finally, this technology is not limited to transporter software. The transporters were using third-party software, but it's the kind of thing that could potentially be built into other digitalization tools like the ones you've been looking at today. So thank you very much, and happy to answer any questions afterwards.
Thank you, Ruth. So the next presentation is a recording of the experience from Angola. Emiliano is not live on the call, so I'll hand over to the technical team to play that recording for us.
Muito bom dia, boa tarde a todos. Eu sou José Franco Martins, sou médico, sou chefe do Departamento de Controle de Doenças da Direção Nacional de Saúde Pública e coordenador do Programa Nacional de Controle da Malária de Angola. Dizer que entre 2022 e 2023, Angola, tanto através do Ministério da Saúde, lançou a primeira fase da campanha de distribuição de mosquiteiros em 6 províncias, onde contamos com o apoio da USAID PMI. E nessas províncias alcançamos mais de 7 milhões de pessoas, mais de 4 milhões de redes mosquiteiras distribuídas. Nesta missão, o setor privado juntou-se a nós, nomeadamente da Unitel. A minha colega Sousa Emiliano, da Population Service International, PSI, Angola, irá apresentar o contributo deste importante parceiro do setor privado. Obrigado.
Thank you, Dr. Franco. And good morning, good afternoon, everyone. My name is Sousa Emiliano, and I am the Marketing and Communications Director at PSI Angola. As Dr. Franco just said, we just finished the PMI-supported ITM distribution campaign. And a single-phase campaign was conducted for the first time with the simultaneous registration of the beneficiaries and the distribution of the nets. And for that, an innovative element was introduced, which was the use of the DHIS2 capture app. And with that, not only we reduced the synchronization time for 48 hours maximum, as it also allowed to decrease the number of errors, as there was no need for an intermediary system, and there was no need for the paper-based form. So the faster synchronization, the reduction in the number of errors, of course, allowed decision makers to have decisions on real time and when needed and on a streamlined process. And as we started drafting this new approach, of course, we anticipated some challenges. And one of the challenges was related with access to smartphones. So we needed to hire activists that did have a smartphone, but we knew since the beginning that the access to smartphones perhaps was outdated, the outdated models, or even if not outdated, not all the models were compatible with the DHIS2 application. So this was one of the challenges identified. Then, of course, it's not easy to ensure that people use the credit and the data plans for the correct end. So how could we grant that people were using the data for the ITN distribution activities and not for social media, for example? And then the logistic challenge. So it's hard to top up the credit plans for over 3,000 people and ensure that everyone has credit when we need to control it all at once. And to overcome these three challenges and others that were then identified, our private sector long-standing partner, Unitel, a telecommunications company in Angola, just came in on board and supported us on overcoming all of these challenges. Unitel's contribution included the donation of approximately 100 smartphones to be used on the digital registration in the field. And a groundbreaking contribution from them was providing the free URL. So by having free URL without the need of credit plans, it allowed all the delays related with credit constraints on sending the data and synchronizing the data with the other systems. And they also extended their support into educating the population with free SMSs that they would be receiving during the campaign to reinforce the net use behavior. So Unitel has not just been a simple participant, but rather a driving force in the campaign. So by joining efforts with our teams, with their technological expertise and the correct resource allocation, they were just boosting the efficiency and efficacy of the campaign and allowing a major scale reach. Also, their involvement in the campaign is a clear reflection of their corporate and social responsibility values. So their contributions have not only enhanced the campaign's efficacy and efficiency, but it also set the standard for the responsible engagement in public health initiatives. And their successful partnership models also provides an example and sets the blueprint for others who can see the benefits of joining the public health initiatives. And for example, in this campaign, we have the support of other private sector partners like Banco Fomento Angola, Angolan Bank, called BFA, because it's like a chain of positive reaction that once other private sector companies see the impact, they also want to join and be featured as partners of this initiative. So this is like a blueprint that Unitel is setting in country. So we often get the question on what's PSI Angola approach for these successful private sector engagement partnerships. And I'd like to think that the approach stands on 5 major pillars, I would say. First, we seek for partnerships that do have shared values. So we try to ensure that the vision and the mission are meaningful for both parties. And then rather than focusing on short-term gains, we try to seek partnerships, and the Unitel is an example of it, that are long-standing partnerships and they ensure mutual growth for both PSI and the private sector partner, and of course for the MOH and the health gains. And for example, with Unitel, we have a set of partnerships that have been successful all over the years. And one of them, of the examples that I would like to highlight, is the Kasai e-learning platform. So this is an e-learning platform that, long story short, was launched by MOH with PMI support. And Unitel provided since day one the free URL access that allows a total of 9,000 health providers in Angola so far. So this was launched in 2021. And so far, 9,000 health providers are enrolled in the Kasai e-learning platform and are learning for free around the 20 health-related courses that are there, because there's no need of credit plans. And this is a major contribution, for example, from Unitel that has a long-standing reflection on the health sector. And then we focus on partners who are committed to the cause rather than going for opportunistic intervention. So we do not reach out to the partner only when we need them, but we try to stand all over the work plans and the mission of both. And not only the positive image of the company, of course the visibility is important, but we try not only to ensure that the company achieves visibility, but also that the company feels this sense of giving back to the community, which is very important. And Of course, everyone is concerned with impact, so we ensure that our private sector partners see the tangible impact of their contributions. And for example, with Unitel, we provide them on monthly reports with the outcomes that were achieved with their contribution. Additionally, as I said in the beginning, Unitel also joint efforts with NMCP and PMI in the social and behavior change effort. So through the support of PMI, and NMCP runs a digital campaign that is really successful in country, reaching over 2.5 million people digitally connected and getting over 1,500 interactions a day. And during the mass campaign, what we did was featuring flash news from the field in this platform. So other than the interpersonal communication activities ongoing in the field, there was also the social media campaign, and Unitel joined efforts and contributed with the SMS campaign. So this SMS campaign is one element that was added with from Unitel, just to ensure that every phone that was registered in the zones, in the provinces targeted with the distribution, all the cell phones were receiving SMS messages totally for free before, during, and after the campaign. So before announcing that the campaign was approaching, and during the campaign and after the campaign to reinforce the net use behavior. And this was also a very interesting contribution from Unitel. As highlights of the campaign, I would say that 7 million people reached with over 4 million mosquito nets, and the dual contribution of the private sector and of the digital tools at once in the same campaign. I would say that in summary, those are the highlights of the campaign. So the collaboration between Unitel, PMI, PSI and the Ministry of Health, as well as the integration of advanced digital technological solutions, boosted the efficiency and the efficacy of the campaign. So I think this underlines, as I was saying, two essential things. In one side, the role of the private sector, and on the other side, the value of the digital tools in global health interventions. At the same time, it serves as a proof of concept that digital works in Angola for these IT and distribution campaigns, and potentially for other public health interventions. As I was mentioning, for example, the e-learning platform targeting health providers named Kasai. So in closing, we can say that other private sector partners, but also Unitel's commitment to public health remains really strong. And through their ongoing support, the provision of technology, the allocation of resources, and all the things that I have explained during the presentation, all of that exemplifies the long-term commitment to public health and the sustained corporate and social responsibility efforts driving positive health impact. So we thank Unitel and we thank all our private sector partners for the partnership and the support. And of course, we look forward to continuing working with them for future accomplishments. And with that said, we come to the end of our presentation. We hope you enjoyed the presentation, and we welcome any feedback, any questions. We are here live, available to respond to your questions. Thank you so much, everyone, and have a wonderful day.
Please appreciate this presentation. Thank you. We will immediately invite Rukari Medard to take a presentation on BYOD in data management.
Good afternoon. I'm going to be brief, considering that we have been discussing digitalization, and also bringing your device. So my presentation specifically will be highlighting issues in Uganda, so digitalization using the bring your own device started in 2017-18 as a trial to make sure that we run away from the paper-based. Then we benchmarked some of the lessons from COVID as part of the COVID adaptation. Then in 2023 concluded campaign, we institutionalized it as part of the government programs. So we have specifically measured two gadgets. Those are the devices. We have the laptop that is brought by the recruited supervisors. We don't buy them. When we are recruiting the supervisor, you come with your laptop. Then are the VHTs, These are village health teams, what we normally call as the data entry cracks. They come with their phones. We have phones that are personal procured and also phones that are supported by the donors to do routine programs. So for Uganda specific, we have a local capacity where we developed our own application because of the security of data. We call it EDMIS. Specifically is used to digitalize the data for the campaign and have it automated to have aggregated reports on time across the campaign and also to ease the entire dissemination of the results. Then as part of the design, it has both on and offline functionalities, but it is only used on a smartphone with Android 4.0. Yeah, 4.0. So if you have a phone that does not qualify within these specifications, automatically you don't qualify to be part of the bring your own device. We are only running them on laptops, so I have not seen them being run on desktops. I don't know where it has. On features. Okay. So what I wanted to highlight specifically on the features, you have seen most of the highlighted features from other applications are within. But specifically for Uganda, we run an application to make sure that we have 105. The 5% is a validation rule. If you have done registration of 100% households, you use the 5% to validate the accuracy of the data. This is what is embedded in the application to make sure that you have accurate data. But specifically for the development of all of this technology for digitalization, it started with the local knowledge, then local piloted, tested, then with fully functional funding, especially on other elements by the Global Fund since 2017 up to today. Then considering that it's local originated, we have an assurance element from MP to make sure that we have quality outputs and also AMF, considering it is one of the consumers for the results. So majorly what led for Uganda to digitalize this campaign? I don't know. Yeah, what led Uganda to digitalize a campaign using bring your own device? Number one is that if you are to buy devices for the campaign, they are very expensive. For the country, we need more devices. So what we decided to do is how to use the local available devices. I think it is very well linked with what we are talking about currently, optimization and prioritization. So we need to see how we can utilize it. Number two, I had talked about it, that if we are to buy the equipment, they are very expensive. Number three, they are also very risky in terms of retrieving all of these devices, considering the complexity of the campaign. You are running about the nets, you are running about the equipment of the phones, the laptops. It is very risky. Then number three, they are failures to repurpose these ICT. When you are running campaign for, let me say, every 3 years, are you going to be buying these devices? Possibly no. If you are not buying them by the time you want to enroll them, some of their batteries are down, the functionality, they need testing. That means you need to continue using these devices. Then considering that there is already investment in the country, especially for Uganda, Global Fund gave us equipment under COVID. We said they are already in the communities, they are already in the facilities. We can benchmark them to make sure that we continue digitalizing the campaign. Then we also have the funding from the community-based data science. It is also available that is supporting the human at the community level, that the VHTs we also benefited to make sure that we bring your own devices. What about the consideration of the challenge of the read time for procurement? If you want to procure this device of campaign, do you have the time? The answer in most cases, considering the procedures for clearance, the read time is not favorable. Because when you bring them in, you need to test them, you need to try them, all those read times must be considered in the procurement read time. Then you know when you procure new devices, automatically the users need to be trained on how to use those new devices. For example, if you are using to iPhone, automatically you need to be used on how you are going to operate the Samsung version. So all of these things are considered, and we are looking at bringing your own devices as a very good opportunity for rolling out the digitalization. What about the difficult to assess for assets management procedures? In Uganda, major global funded countries, the issue of asset register. If you have these devices and you don't have a very good asset register, then you will have very many audit queries considering the condition. So therefore, you must have a robust assets register. Then what about the difficulty, the lack of acceptable disposal plan? For example, if you have procured devices this year, within 3 years, you need to have a plan for disposal. Is it available? The answer by then it was not available. So the option, still the option is to make sure that we ask people to bring their own devices. Conditional procedures. Are you going to have them through WAMBO? Are you going to do local procurement? And you know the complexity of local procurement. So when we factored all these things, we discovered that bringing your own devices is more paramount and can give you results. So what are the key achievements? Majorly when I was talking about the bringing them on board, I talked about the achievements. One is that you have already investment from different donors. For example, in Uganda, Growth Fund has funded very many equipment. They are available in the districts. They are very good opportunities. The same as UNICEF, also the PMI. That means the people can be enrolled to be part of the campaign. Minimum data loss, we talked about it. Government ownership and donor acceptance. Everyone would want to go digitalization as part of the procedures. The rest of the things have been talked through as part of digitalization, but what is unique with Uganda, you can see over 35,000 users can be used at the same time. That's why we can be in a position to run a short campaign. So there are some lessons picked, but I would be faster considering the time. Yeah. On the upload, I don't know why it's not moving. It had very many things on upload. One on the data synchronization, where we said we need to avail the data entry class with the bundles to make sure that the data comes in. Then for ICT, you know, these devices, some of VHTs have, let me call it the Chinese phones. They are not compatible to the application. So when you have some of those versions of the phones, you find they take long. You mark them during microplanning. By the time of distribution, they are not compatible with application. Then also, we also know there is a risk of data loss, especially if they steal those phones, the laptops. What do? We make sure that we take precaution as part of the rollout. Then the literacy level, considering the literacy level of the people you are enrolling, they are running smartphones, but are they trainable based on the capacity of the application? The answer is yes or no, then you enroll. In terms of remuneration for allowances, some of our VHTs saw that these VHTs will have to be paid or data entry clerks when data has come in. They don't give you data. So we are saying that we make sure the allowances are available to make sure that the data comes in. Then there was also an assumption that the allowances will come and hire the phones because the condition is to bring your devices. That means if the phones are being borrowed and the owner takes it automatically, it means there is a risk of borrowing. Then we also learned that when you are running a digital process, you need the competent people to monitor the system. If the system is not monitored, you can have a system downtime, then it either crashes or you lose the data. Therefore, you must have a very specialized database and system admin to continue monitoring the process. So what are the key lessons? I'd say one, it is cheap, considering that the resources are available, apart from buying a few things, giving bundles, also making sure that the batteries are available. Then it is also very easy to be institutionalized, considering that the people are coming from the district, from the government structures already equipped with those items. Then it promotes more technology to match internationals. So when you are in a country, you are hearing this country is doing a digital process, you need to put in efforts to make sure you fit within the acceptable national standard. Then considering the digital against the paper, it has minimal errors. It has minimal errors because we have timely troubleshooting of the problems. Then we also noted that we need to have a special consideration when we are doing the digitalization. Some areas completely will have no network, or the literacy level will not be accepted to do digital process. You need to have a hybrid digitalization process. Then we also need to know that when you are having your application, you have to have minimal variables to be picked, considering the capacity of the data entry cracks. If you pick very many variables, automatically the data entry cracks, considering the level of education, will compromise the quality of the data. Then we also learned that data bundles can be used for other purposes. You give them data bundles to send in data, they use it for other social media benefits. So thank you very much, and I appreciate for your patience.
So thank you. Our last presenter is from WHO, and I know that they know how to manage time very well. So I give you.
Good afternoon, colleagues. My name is Chipongongwani, and I'm an Innovation Ecosystems Management Specialist under WHO Afro. I'll be very short. I won't take a lot of time. Okay, yes. So I'm here to present to you an initiative that we're doing. So it's on developing a toolkit guidance on digitizing campaigns. So the objective of this presentation is threefold. Firstly, to provide an overview of what this toolkit actually has. We've been developing it with partners, so it's not only us, to guide the digitization of health campaigns. And this toolkit, we really want it to be for our member states to inform them, and also for their partners to design and implement locally owned campaign digitization tools. So that's very important for sustainability and so forth. And the third part is to raise awareness. I'm sure people didn't know that we were developing guidance, so this is something that we'd like you to also be a part of. So I'm not going to preach to the converted, because you are the converted. You know why digitization of campaigns is important in terms of our the data sensitivity, also improving even the campaign management and delivery and so forth, and even our monitoring and evaluating. Okay, yes. So now coming to our toolkit, I'm not sure what, yeah. Coming to our toolkit, how we've actually developed it. We've done it through a number of demonstration countries that we've worked with in terms of following their campaigns and looking what's happening with health campaigns in those countries. So this is not only aligned with malaria campaigns, we're looking across various campaigns. So we've done landscape and situational analysis, and then we've also done key stakeholder workshops and meetings for alignment. We've also solicited expert feedback. We have a campaign digitization working group, which I'm also soliciting right now, so that you can also be a part of it and help us with feedback on this guidance. And also we have shadowed campaigns to gather insights. So at the present moment, as a disclaimer, we know that a toolkit can be evolving and can have additional things, but at the present moment, we have these particular tools in our toolkit. Firstly, we have a digital product selection framework. So this is a framework for when you want to choose a tool as a Ministry of Health or for a particular campaign, what are the aspects that you would look at? Then we have a digital products comparison kind of glossary. And then we have a technology reference architecture. So this is basically to say, the target product profile of an ideal tool for digitizing a campaign, but then of course you customize it according to the situation or the context that you're working with. Then we have a functional business requirements document. I'll go more into that in the next slide. And then we have a digitization implementation guidance overview guidance as well. With this one, we're talking about governance. This is something which has come up a lot in this particular meeting. The way that something is governed is important, especially if you have all the stakeholders at the same place, at the same time, alignment and so forth. So this gives best practices, lessons learned, and so forth. And also, lastly but not least, the monitoring and evaluation and learning framework. So when it comes to the functional business requirements document, just as a snippet of what it's about, so this is a reference for designing, developing, and implementing your technology solutions when you're digitizing a campaign. Currently, it has an overview of including a template for how you'd actually describe your use case or select it. Then we have the campaign digitization categories, which are the core data registries, but this is just a snippet. So if you want to know more, you definitely have to engage with us to also see these documents and give us your feedback, as well as an alignment of the use cases and also description of the workflows aligned with that. So if I'm to go into, okay, let me go back a bit. So if I'm to go into the particular aspect of use case description and the workflows, an example is giving a proper definition of what particularly this use case is about, giving the background context to that. And then we also list all the possible workflows, which is something I've also seen a number of solutions showing around us, the particular workflows that are aligned with the digitization of a campaign. So currently we have about 10 categories for these workflows. So these include the purpose, the participants that will be part of it, the pain points of that workflow, the mode of interaction, the preconditions aligned with that, the flow of activities to be sure of what activities are happening, any variants that you might actually be thinking about, any exceptions that might happen, and also the business rules that align with affecting your workflows for that particular use case, and also the inputs and outputs. Another example is our product tool selection framework. So this is another guidance, as I mentioned before. So this framework is made up of, at the moment, 9 steps, of which how would you actually select a tool? What are the processes you go through? What are you supposed to do? So as a process, would firstly start with the convening of an assessment team. And then we ask ourselves, do we actually have digital health legislation? So in this case, we're asking ourselves, do we have an up-to-date digital health legislation? Most of our member states are in the process of either updating their digital health strategies and so forth. So that's also an important question. I know it would be like a da-hey kind of thing, but it's not really like that. So if we don't, then we ask ourselves, do we agree on whatever is aligned with the national minimum standards for digital health if we're looking at this particular campaign? And also, if we actually agree on that, we now discuss on what exactly is the problem definition and the program outputs of this particular tool that we want to use for this campaign. Then we move on to now looking at, looking at the use case identification, which are linked to these outputs, and agree on the digital health candidate list that can be listed there. And then would now recommend 2 or 3 tools which we think can actually align with whatever the aspects and the outputs that we want from this particular digital health campaign, digital health implementation. So some of the tool assessment categories aligned with this that we look at include product functionality, product validation, is it fit for purpose? The technology, especially aspects around interoperability, standardization, open source versus closed source. I think most of the product tools were being asked these questions in the demonstrations. And also looking at the organizational capacity. Do we actually have available knowledge assets? Do we have a knowledge hub? Do we have experts that are readily available? And then looking at the processes themselves, as well as how do we actually develop the software. So that's an overall some of the categories. So the next steps for us is we are still in development of these particular guidance. So we're soliciting your feedback. If you are interested in being part of this developmental process, you can help us by reaching out to me and so forth. So we're looking to consolidate this feedback and hopefully disseminate the guidances by the second quarter or the third quarter of this year. Thank you.
Thank you so much. So we've listened to 8 people. There are about 2, 4, 6, 7 people. And we'll just take 3 questions because of time. We'll decide after that. But let's take the first 3. 1, I'll give you a number. 1, 2, and 3. Can we pass the mic? Okay, go ahead.
Thank you very much, Chair. Paul Sekis from PMI Zambia. Thank you for the opportunity for countries to share experience. I wanted to expand on Ruth Segalin's presentation and also help to respond to a question raised by our colleague Yvonne from Burundi yesterday. This has to do with how you can work with Against Malaria Foundation in terms of their requirements for donating nets. And not to get into too many details, but AMF has a business model that creates a whole new faucet, a whole new stream of resources available for malaria control. And of course, as partners, we have to be flexible, but we have to also respect AMF's unique business model. So in Zambia's case, in 2017, AMF came with certain conditions. It was difficult to meet, practically speaking. In 2023, we got together well in advance and said, look, AMF can bring 6 million nets, very much needed. And PMI and Global Fund looked at their resources and literally said, okay, AMF will donate the nets. They require somebody to support the non-net costs. And so as the famous MOU AMF requires was worked out, we sat together and 2 things, the sharing common values that we wanted to have a successful campaign, and then practically speaking, having a costed work plan. So, all right, digitalization is going to be expensive. Who's going to do that? Enhanced EPOD is going to be necessary. How are we going to do that? And PMI, for its part, literally took $3 million away from procuring nets and said, we'll spend that money on this technical assistance, and thereby bringing to the country $22 million worth of nets. Global Fund did something similar. So we had a lot of experience with this in Zambia, and it actually went pretty well. We'd be happy to discuss further or suggest a similar approach in other countries. But to get to Yvonne's question, yes, there's requirements, but there are practical ways to deal with it as long as you plan together well in advance. Thank you.
Thank you. Please, the next people, when you're asking, just go straight to the point. Thank you. Number 2.
All right. Thank you for the presentation. My question is for WHO. The toolkit is for which campaigns? We have a lot of campaigns, polio, immunization, malaria. So which campaigns are they looking at? And I know if malaria is part of it, I know AMP has a malaria decision-making for digitalization. Have they worked with them? Have you seen what they have? Is it something that can work together instead of reinventing the wheel on some of these things? Thank you.
Number 3.
For Zambia, would you do 3 distribution providers again? Were there challenges in non-standard across the 3 transporters? And why did you not do barcode scanning at the 2 lower levels as initially planned? Over.
Okay, the presenters can respond. Yes.
Hi. Oh. Hello? Sorry, could you repeat the first part, Sid? Oh, were they the same?
Would you do it again?
Great, thanks. So, yep, good question. Really great having 3 transporters because we could compare the differences. They had slightly different systems. One of them had a platform, so a website that you logged onto and could see all deliveries. The others emailed you an email per delivery. So that changed how you were accessing the information. In terms of the type of information on each document, they were fairly similar. Worth noting that all three of them were using global products, not specific to health or to mosquito nets. They were kind of off-the-shelf products that they'd procured, and I think mostly were paying a monthly fee for. There were important differences in terms of their scanning capability. And I think that kind of leads nicely onto your last question of why we didn't do scanning on delivery everywhere. Firstly, there was a huge time pressure on the campaign. There'd been, as if you were here earlier in the week, we had a great presentation on the challenges that digitization brought, as well as the advantages. So there was a real time pressure to get nets out quickly. And interestingly, so the transporter that got given the most provinces because they were performing best, in the first province, they said, this scanning takes too long, it adds too much time, we're worried we can't stick to schedule if we have to do it. They actually got more optimistic through the campaign about how quickly they could scan. But I think that was the key factor, was that it was adding some time of debatable amount in a campaign that was already time pressured and a delivery schedule that was time pressured. The other reason I think we let that drop was because we weren't doing that reconciliation piece. And it wasn't actually possible in this case to reconcile net bales loaded with bales delivered, because the bales loaded were scanned by the warehouse with their software, it went into their system. The bales delivered were scanned by the transporter with their app, an app on the driver's phone. And the time it took for us to get the barcode numbers, to receive them, and then it would be setting up our own checks. Like, it just wasn't practical, particularly at a fast-moving campaign. So really, if you're serious about doing that piece where you're double scanning and you're reconciling, it needs to be on the same platform. And that's where, in that case, it probably needs to be centrally owned rather than transporter owned, unless you get a transporter that can kind of take its responsibility of both ends. Hope that's helpful.
The next, WHO, right?
I'm not sure where the question came from, but I'll just answer looking straight ahead. The toolkit is not campaign specific. We do acknowledge the work that has been done as well with AMP. We have acknowledged it, especially in the development of our guidance for best practices, and also the real-time monitoring work by UNICEF and so forth. So it's something that we definitely are not saying we're starting on our own, but we're also standing with others. And hence we are also raising awareness that this is something we're developing. The lessons we've learned have been through shadowing various campaigns, not just malaria-specific campaigns. So this is something which is not just, we are not going to be doing it alone as well. And so I'm saying we're soliciting feedback, and also for you to tell us that maybe we've missed something. What have we actually replicated? If you feel we've replicated something, because these are guidances we're waiting to share with you for feedback.
Thank you. We have provision for 3 more questions. So 1 at the back, 2, and 3. So 1.
Okay, thank you so much. I have 2 questions. I will ask the first question to the first 2 presenters. You mentioned the use of devices to collect data during registration, and I was wondering how you manage daily data synchronization. We all know that data needs to be reported daily or periodically so that we can have a picture of what is happening in the field. But I didn't see where you mentioned it in your presentation, how you manage that. And secondly, we also know that the real-time data being generated from the devices can be used to support monitoring and supervision. So I wanted to know if you had that feature also enabled that helped the monitors and supervisors on the field, see and maybe improve on the processes on the go. Then my second question is to, I think it's the Kenya team that uses Rwanda, right? BYOD. And I wanted to know how you manage your data loss when the devices are being stolen or reported missing before the unsynchronized data on the devices. When you hear the reports that their devices have been stolen or missing, what do you do to the unsynchronized data on the devices that have been affected? Thank you.
Number 2. Please, can you get her the mic?
Thank you. My question is to the Uganda team. Still on the Bring Your Own Device. So you did mention that your application for the app to run on the phone has to be on Android 4.0, I think so. So I would like to ask, what's the process of verifying all of the CDDs or whoever is the users of that particular app at the community level? What process do you use to ensure that the app, the phones they are bringing meet that specification? And also assuming that you're recruiting those people, the recruitment of that community volunteers or workers is online. So that means you might not necessarily have physical contact with them, except probably you are bringing them in for interview or something if you do that. So how do you ensure that the people that you are selecting, their phone meets that particular specification? Also, I think it captured part of the question I wanted to ask in terms of data integrity, data protection. How long does the data on the app sit when they have synchronized? So because at the end of the day, the app is still on their phone and the data is there. So how long does it sit on the phone when the data has been synchronized to the central server? Thank you.
Number 3.
Merci beaucoup. Ma question s'adresse à l'Ouganda. Et moi, je pense même la présentation reflète même, c'est pareil avec ce que M. Ba de Togo a présenté hier, l'utilisation des téléphones pour digitaliser la campagne. C'est eux-mêmes qui vont, ils ont les téléphones de la communauté. Est-ce que vous payez ces agents? L'amortissement de leur téléphone, est-ce que vous les payez? Ça c'est de 1. Deuxièmement, au cas où vous arrivez dans un coin où il n'y a pas de téléphone, quid? Merci.
Okay, over to us.
Ok, merci beaucoup pour la parole. Alors, la question qui m'a été adressée concerne les aspects de synchronisation des données dans les endroits éloignés, notamment dans les zones de santé pilote, là où l'expérience pilote a été menée. Alors, c'est vrai que dans mon intervention, j'avais relevé plusieurs défis, notamment des défis liés à la connectivité. Et par rapport à cette question spécifique, une solution avait été proposée, notamment l'utilisation éventuellement des VSAT portables. Et dans le cas spécifique de notre projet, c'est ce qui avait été éventuellement utilisé. Donc, dans ces 2 zones de santé pilote, là où le projet d'expérience pilote de digitalisation des campagnes avait été mené. Donc, c'est, je dirais, une approche qui est importante ou intéressante justement pour gérer ce problème lié à la connectivité, surtout dans des endroits éloignés, notamment dans cette zone où cette expérience pilote avait été menée. Alors, je crois que par rapport à la deuxième question, je laisserai l'équipe qui nous a accompagnés ici et qui, en fait, nous ont la parole à M. Jean-Louis, par exemple, pour soit compléter la réponse que je donne à la première question et répondre à la deuxième question, s'il vous plaît. Merci.
Okay, the question is for Uganda.
Donc, parlant de la première question, donc, il y a eu des modems Starlink qui ont été utilisés et il y avait des superviseurs qui s'est déplacés de point en point pour pouvoir aider les agents à pouvoir synchroniser les données pour, surtout pour la zone rurale des Kabundo Dianda qui avait au moins 15% des taux de pénétration en Internet. Peut-être la deuxième question, je n'avais pas suivi, tu peux.
C'est par rapport aux fonctionnalités de l'outil en termes d'amélioration dans le cadre de cette expérience pilote. Quelles sont les fonctionnalités qui ont permis justement d'améliorer la situation?
Donc, côté synchronisation, il n'y a pas eu assez de problèmes par rapport à l'outil. Donc, les seuls problèmes que nous avons eu, c'était d'augmenter à chaque fois la capacité du serveur. Donc, tout au départ, les dimensionnements n'ont pas été faits correctement et au fur et à mesure de l'exercice, on a été amené à corriger ces dimensionnements et on n'a pas eu de soucis. Et ce qui nous a amené à conclure qu'on pouvait aller à l'échelle pour l'année en cours.
On the phone specifications, especially the Android 4.0, we normally map them during micro-planning exercise. We map them through the VHTs and health assistant in the districts. Then we know that these devices are available for deployment. That's the advantage with micro-planning. Then in case there are some gaps, we pick it as part of micro-planning, we look at alternative means. However, we also know that in addition to supporting the phones, we have the supervisors who come with their laptops also to support, troubleshoot some of the problems. So we don't just come and deploy, we only do mapping during micro-planning. Then for difficult areas, especially where there are no phones, the literacy level, I said those are special considerations where we normally deploy paper, but we normally make a data center in that specific place. Then after the information has been collected on the paper, they come together in the data center, they have people, trained people of a high class, not necessarily the data entry clerks of the villages, to populate this information or digitalize this information as part of the SOP for the campaign. Thank you.
So thank you to all the presenters and thank you to the audience for the questions. If you have other burning issues you want to discuss with them, you can also meet them after now. A round of applause as we allow them return to their seats. Meanwhile, I hand over to Jason Pitts to round up the session.
I'd just like to also thank Philip. So please, a round of applause for a very complicated session. Thank you very much. So now I would like to welcome Sunude to come and provide the closing remarks. So Sunude, as many of you know, is from the Bill and Melinda Gates Foundation, and he will be providing closing remarks. He's just coming around, so it'll take him a couple minutes to get up here. can use this one.
Bonsoir à tous. Bonsoir à tous. Merci beaucoup. Donc, je suis Senoulé Jean Fortuné d'ailleurs. Je suis chargé du partenariat stratégique pour l'Afrique francophone, pour le PALU à la Fondation Bill & Melinda Gates. Je suis très heureux de pouvoir cet après-midi, comme l'a demandé AMP, de faire quelques mots en termes de closing remarks. Mais fiches sont en anglais, donc j'irai plutôt en anglais. So I wanted to start this closing remark by extending our congratulations to all of the National Disease Program and partners that have presented over the past 2 days and generated very interesting and fruitful discussion. We started the meeting with a presentation on the value and potential of digitization, but also with an emphasis on the learning we'll still need to do and the challenges that will be faced as countries transition to digital tools, scale them, and continue to ensure that they are fit for purpose. We've been fortunate to hear from many countries such as Angola, Congo, DRC, Kenya, Togo, Uganda, and Zambia on their experiences, success, challenges, and recommendations for use of digital tools in various areas. Bring your own device generated a lot of discussion and is an exciting way forward to bring down the initial investment cost for starting up digitization, as well as resource barriers to scaling up. We heard from partners focused on various elements of digitization across disease programs and have learned more about the expansion of geospatial tools for solving critical operational bottlenecks, including establishment of population denominators and ensuring population and access to service being delivered. I want to continue my speech in highlighting several important points from the Bill & Melinda Gates Foundation perspective. We decided to financially support AMP to organize this workshop because we are firmly convinced that digital health is instrumental in optimizing the way we operate health campaign. This technology must be accessible to everyone in need. And this meeting is definitely a great opportunity offered to our community to connect and get more exposure on the new technology and to share, of course, experience. This is why we stand with the MP and will continue to providing support in the upcoming years. We are looking to optimize the investment made in campaign service delivery by ensuring that open access, end-to-end modular digital platform is available to program and can be aligned to specific context and need. My final point will be the following. I would like to congratulate AMP for the great work they are doing to support countries. We are very happy and satisfied with the amazing support that they provide to the different programs across the different geographies. Please, let's give them a round of applause. Et merci beaucoup à tous.
Good. I wanted to thank Sanude and the Bill & Melinda Gates Foundation. As he's mentioned, our ability to expand the earlier partners meeting and to actually have this meeting is based on support from the Gates Foundation. So once again, thank you very much, Sanude, and thank you to the Gates Foundation. I'd also like to thank the planning team. Robert, if you could stand up and just wave. So this is Robert, but it's also the Bill & Melinda Gates Foundation, Catholic Relief Services, Clinton Health Access Initiative, Malaria Consortium, WHO, and Gavi. So these are the 6 organizations that together pulled this agenda. So thank you very much. If I could ask our product solution partners in the room just to stand, and we wanted to acknowledge you. So thank you for attending for all of the side events. So thank you very much. You can stand up. Thank you. On that note, there's a missing phone at the back of the room, so it's going to be very difficult to apply digital solutions when you lose your mobile phone. So it's with Oriane. She's at the back if you lost your phone. I'm going to invite Molly to come up. Tomorrow, some of you will continue with the denominator meeting. So Molly will just describe that meeting and where we're going to have it and when we're going to start.
Hi, everyone. Thanks. Molly Robertson with the Global Fund. I am excited after this, especially as all of that you've talked about, both in the AMP meeting and the digitalization meeting, is very important to us in determining population denominators. It's very important both for understanding what digital solutions can help us do that, as well as what that means for campaigns. So for those of you who are staying on for the population denominators meeting, this will be in this same room. Actually, the room will be divided and will be at the back, and we will start at 9 a.m. So it will be 9 a.m. tomorrow, and then we'll begin again at 9 a.m. on Saturday, and we will run through about 4 or 5 p.m. on Saturday. I just want to also thank AMP, huge thanks for allowing us to back onto your meeting, and a huge thanks to the Gates Foundation for providing the space and the time to be able to hold this meeting. So I look forward to seeing some of you tomorrow, and thank you.
Great. And then one final thanks from myself for Oriane, Marcy, Robert, for the AMP team that really pulled all of this together. So thank you very much. 2 final points. The evaluation is there on the screen. We'd really ask people to complete the evaluation before you leave the room. And I think what's important, it's the second year we've run this meeting, right? And when I think back to when we started those AMP meetings, we started with kind of 75 people, then we went to 90, then we went to 100, 110. So they grew incrementally. This is a massive meeting and it's happened very quickly. So we really would appreciate both complete the evaluation, but if you have suggestions on how we can improve this meeting next year, the functionality of this meeting, the structure of the meeting, please do share that with us because we're very open to ideas on how to improve this. And then final point is we have the final tea and coffee just out here at the end of the day. So thanks once again, everyone, and we'll see you in 2025, possibly here in Nairobi or in another country on the African continent. So thank you very much.